The cardiac monitor screamed in flatline harmony with the storm raging outside Blackstone Memorial Hospital. General Marcus Hale, the man who'd led 3 classified operations that changed modern warfare, was dying, and no one in the sterile trauma bay could save him. His eyes rolled back, his pulse vanished. Then his hand shot up, clamped around the chief surgeon's throat, and dragged him down close enough to taste copper and fury. What came next wasn't a prayer. It was an order that made every doctor in the room go pale. "Get me." The nurse, "You fired." Before we dive into this story of justice, betrayal, and one woman's silent power, hit that subscribe button and stay until the very end. Drop a comment telling me what city you're watching from. I want to see how far this story travels across the world. Evelyn Cross had exactly 11 minutes to clear out her locker before security arrived to escort her off hospital property for the last time. She moved mechanically, her hands still trembling from the adrenaline crash. The locker door hung open like a mouth mid-scream. Inside, 3 spare scrub tops, a half-empty bottle of ibuprofen, a photo of her daughter's college graduation, and a name badge that no longer meant anything. She'd been a critical care nurse for 16 years. 16 years of double shifts, of holding hands during last breaths, of being the steady voice in rooms where chaos ruled. And now it was over because she'd made a choice that saved a life. The young soldier, Private First Class Danny Reeves, barely 22 years old, had been bleeding out from a training accident, shrapnel in the femoral artery. The attending physician was stuck in traffic, barking orders over speakerphone that made no sense given the kid's vitals. Evelyn had seen enough battlefield trauma cases during her time with the mobile surgical units to know Danny had maybe 4 minutes before his brain started dying from lack of oxygen. So she'd made the call. She bypassed protocol, grabbed the surgical tray, and clamped the artery herself. Danny lived, and for that, Evelyn was labeled reckless, insubordinate, and dangerous. "You overstepped," Dr. Richard Voss had said during the disciplinary hearing, his voice dripping with the kind of condescension that came easy to men who'd never had to make a life-or-death decision in under 60 seconds. Voss was chief of surgery at Blackstone Memorial, a position he'd held for 3 years and wielded like a scepter. He had perfectly styled silver hair, a collection of awards that lined his office walls, and a reputation for excellence that somehow never translated into actual compassion. Nurses follow orders. They don't make surgical decisions. You compromise patient safety and hospital liability. Evelyn had tried to explain. She'd presented the vitals, the timeline, the medical literature supporting her intervention. But the hospital board, stacked with administrators more concerned about lawsuits than lives, had already made their decision. Dr. Voss wanted her gone, and what Dr. Voss wanted, Dr. Voss got. Now she stood in the staff locker room, stuffing her belongings into a canvas bag while the fluorescent lights buzzed overhead like angry insects. The room smelled of disinfectant and stale coffee. Someone had left a motivational poster on the wall. "Every patient deserves your best." Evelyn almost laughed. She'd given her best, and it had cost her everything. The door swung open. Marissa Chen, one of the ER nurses and the closest thing Evelyn had to a friend in this place, stepped inside. Her face was tight with anger. "This is bullshit," Marissa said. "Everyone knows you saved that kid's life." "Doesn't matter," Evelyn replied, zipping the bag shut. "Voss made an example of me. Can't have nurses thinking for themselves. He's a coward. He knows you made the right call, and he can't stand that you were willing to risk your career, Sis, when he wouldn't risk his reputation." Evelyn slung the bag over her shoulder. "It's done, Marissa. I'm not going to fight it." "Why not? You could appeal. The union would back you. Hell, Danny Reeves himself said he'd testify." "Because I'm tired." The words came out heavier than Evelyn intended. "I'm 53 years old. I've spent 16 years in this hospital, and the only thing I've learned is that the system doesn't protect people like me. It protects people like Voss." Marissa opened her mouth to argue, but footsteps echoed in the hallway. 2 security guards appeared in the doorway, their expressions carefully neutral. Evelyn recognized them. Carl and Jim, both decent guys who looked uncomfortable with their assignment. "Ms. Cross," Carl said quietly, "we need to escort you out." Evelyn nodded. She took one last look at the locker room, at the place where she'd changed into scrubs thousands of times, where she'd cried after losing patients and celebrated when miracles happened. Then she walked out, flanked by security, like a criminal. They led her through the main corridor. It was shift change, and the hallway was crowded with nurses, doctors, and techs. Conversations died as Evelyn passed. Some people looked away. Others stared with a mixture of pity and relief that it wasn't them being marched out. A few, like old Dr. Patel from oncology, gave her small, respectful nods. But no one spoke up. No one challenged the narrative that Evelyn Cross was a problem that needed to be removed. Dr. Voss stood near the main entrance, watching her approach. He wore his white coat like armor, his arms crossed over his chest. When Evelyn drew close, he leaned in just enough that only she could hear. "You should have known your place," he said softly. "This is what happens when people forget the hierarchy." Evelyn met his eyes. She didn't flinch, didn't look away. "I know exactly what I did, and I'd do it again." Something flickered in Voss's expression. Annoyance, maybe, or the faintest trace of uncertainty. But it was gone in an instant, replaced by his usual mask of smug authority. "Enjoy the rest of your career," he said. "I'm sure there are plenty of nursing homes that need help changing bedpans." Carl cleared his throat. "Sir, we need to finish the escort." Voss stepped aside with a dismissive wave. Evelyn walked past him, through the automatic doors, and out into the rain. The storm had rolled in fast, turning the afternoon sky dark and angry. Rain hammered the pavement, soaking through Evelyn's scrubs in seconds. She stood on the curb, her bag clutched to her chest, and let the water run down her face. It felt cleansing in a way, like the hospital was finally being washed off her skin. She didn't know that 6 floors above her, in the private wing reserved for VIP patients, General Marcus Hale had just been admitted in critical condition. She didn't know that within hours, the man who'd survived 3 wars and countless classified operations would be dying from something no doctor at Blackstone Memorial could identify. And she definitely didn't know that her name, her full name, spoken with absolute certainty, would be the last coherent thing the general said before his heart stopped. Evelyn climbed into her car, started the engine, and drove away from Blackstone Memorial for what she believed was the final time. 6 months crawled by like wounded animals. Evelyn's world shrank to the size of a night shift animal clinic on the outskirts of Greystone City, a place where the fluorescent lights flickered worse than the hospitals ever had, and the smell of wet dog was a permanent fixture. She scrubbed kennels, assisted with after-hours emergencies, and tried not to think about the career she'd lost. The pay was a third of what she'd made at Blackstone Memorial. Her daughter, Sarah, called twice a week from Seattle, voice tight with worry that Evelyn kept insisting was unnecessary. "I'm fine," Evelyn would say, standing in her cramped apartment kitchen, staring at the single window that overlooked a parking lot. "Really? I'm fine." She wasn't fine. She was haunted by the sound of cardiac monitors, by the memory of Danny Reeves's pale face, by the way Dr. Voss had looked at her like she was something to be scraped off his shoe. But she got up every morning, put on her clinic scrubs, and kept moving, because that's what she'd always done. It was a Tuesday night when her life detonated for the second time. Evelyn was in the back room, reorganizing medication supplies, when the front door of the clinic burst open with enough force to rattle the windows. She heard Dr. Patel, the veterinarian, not to be confused with the oncologist from Blackstone, shout in surprise. Then came the sound of boots on linoleum, heavy, purposeful, moving in formation. Evelyn stepped into the hallway and froze. 4 soldiers stood in the clinic's waiting area, dressed in full tactical gear. They weren't regular military. Their uniforms lacked standard insignia, their weapons were high-spec, and they moved with the kind of precision that spoke to special operations training. The lead soldier, a woman with sharp eyes and a scar running along her jawline, locked onto Evelyn immediately. "Evelyn Cross?" the soldier asked. Evelyn's heart kicked into overdrive. "Yes, you need to come with us, now." Dr. Patel, a small man with wire-rimmed glasses, stepped forward. "Wait, you can't just—" The soldier didn't even glance at him. "This is a matter of national security, sir. Ms. Cross, we have authorization to bring you in by force if necessary, but we'd prefer your cooperation." Evelyn's mind raced. National security? She hadn't done anything remotely connected to... Then it hit her. Danny Reeves, the soldier she'd saved. Had something happened? Was this some kind of investigation? I don't understand, Evelyn said carefully. What's this about? We'll explain en route. You have 60 seconds to grab anything you need. En route where? The soldier's expression didn't change. Blackstone Memorial Hospital. We have a situation that requires your immediate expertise. The air seemed to leave the room. Blackstone Memorial. The place that had destroyed her career, the place she'd sworn she'd never step foot in again. And now the military, the actual military, was telling her she had to go back. I don't work there anymore, Evelyn said. They fired me. I'm sure they've made that very clear. We're aware of your employment status. This isn't a request, Ms. Cross. This is a direct order from the highest levels of military command. A patient's life depends on your presence in the next 30 minutes. Evelyn looked at Dr. Patel, who seemed completely out of his depth. Then she looked back at the soldier, at the three others standing behind her with their hands resting on their weapons, and made a calculation. She could refuse. She could demand to see paperwork, call a lawyer, make a scene, but the look in the lead soldier's eyes told her that wouldn't end well. Give me 2 minutes, Evelyn said. She grabbed her personal bag from the staff room, her hands shaking as she stuffed in her wallet and phone. Her mind was spinning. Who was the patient? Why did they need her specifically? And why the hell would the military override a hospital's firing decision? When she returned to the waiting area, the soldiers immediately flanked her. They moved as a unit, escorting her out to a black SUV parked illegally across 2 spaces. The vehicle was armored. Evelyn could tell by the way it sat heavy on its suspension, and the windows were tinted dark enough to be illegal in most states. She climbed into the back seat. The lead soldier took the front passenger seat, and the driver pulled out before Evelyn even had her seatbelt on. They didn't speak during the 20-minute drive. Evelyn tried asking questions. What kind of patient? What's the medical situation? Why me? But received only silence in response. The SUV moved through traffic like it didn't exist, other cars pulling aside as if they could sense the authority radiating from the vehicle. When Blackstone Memorial came into view, Evelyn's stomach twisted. The building looked exactly the same. 7 stories of steel and glass, with the emergency department entrance lit up like a stage. But something was different tonight. The parking lot was filled with military vehicles. Soldiers stood at every entrance, and on the roof, barely visible through the rain, sat 2 massive helicopters, their rotors still. The SUV didn't pull up to the main entrance. Instead, it swung around to a service bay usually reserved for supply deliveries. The door was already open, and more soldiers stood waiting. Evelyn was hustled out of the vehicle and into the hospital through a route she'd never used before, one that bypassed all the public areas and led directly to the service elevators. They rode up in silence. Evelyn's reflection stared back at her from the polished steel doors, hair pulled back in a messy ponytail, face pale, still wearing the cheap clinic scrubs with a stain on the left knee from where a nervous terrier had peed on her earlier. She looked like exactly what she was, a washed-up nurse who'd been yanked out of obscurity and thrown back into a world she no longer belonged to. The elevator stopped on the 6th floor. The doors opened onto controlled chaos. The ICU wing had been completely militarized. Soldiers stood at every intersection. Medical equipment she didn't recognize had been wheeled in. And the noise, the constant beeping of monitors, the hiss of ventilators, the low urgent voices of doctors and nurses, created a wall of sound that immediately triggered Evelyn's old instincts. She was led to a room at the end of the hall. Through the window, she could see at least a dozen people crowded around a bed. Most wore military uniforms, but a few were in surgical scrubs. And standing at the center of it all, directing the chaos with the same arrogance she remembered, was Dr. Richard Voss. The lead soldier opened the door. Every head turned. Voss's expression went from confusion to recognition to fury in the span of a heartbeat. What the hell is she doing here? She was requested, the soldier said simply. Requested? By whom? I'm the attending physician, and I certainly didn't. By the patient. The room went silent. Even the monitors seemed quiet. Evelyn stepped forward, her training overriding her nerves. She moved to the bedside, and for the first time she saw the man they'd brought her here to save. General Marcus Hale looked nothing like the legend. The man in the bed was in his late 50s, with gray stubble and a face carved by decades of hard decisions. His skin had a grayish tint that Evelyn recognized immediately as shock. His breathing was rapid and shallow. The cardiac monitor showed an irregular rhythm that made her teeth clench. IVs ran into both arms, pumping fluids and medications that clearly weren't working. "Someone give me his chart," Evelyn said. Voss stepped in front of her. "You have no authority here. You're not even employed by this hospital anymore. I don't know what strings you pulled to—" "Doctor." The voice came from a man in a general's uniform standing near the window. He was older than Hale, with the kind of presence that made everyone else in the room seem smaller. "Step aside." Voss opened his mouth to argue, saw the look on the general's face, and reluctantly moved. A nurse, one Evelyn didn't recognize, handed her the chart. Evelyn scanned it quickly, her eyes picking out the key details. Admitted 4 hours ago with symptoms consistent with anaphylaxis. Massive histamine release, blood pressure crash, airway constriction. Standard protocols had been followed. Epinephrine, antihistamines, corticosteroids. But nothing was working. In fact, the patient was getting worse. "What was he exposed to?" Evelyn asked. "We don't know," Voss said. "He collapsed during a classified briefing. No food, no environmental allergens we can identify. We've run every test." "His coagulation panel," Evelyn interrupted, still reading. "It's completely out of range. PT, PTT, INR, all critically elevated. This isn't anaphylaxis." Voss's jaw tightened. "Of course it is. The symptoms are textbook. The symptoms are mimicking anaphylaxis. But look at the timeline. His platelet count is dropping, his fibrinogen is through the floor, and he's developing petechiae." Evelyn pointed to the small red spots appearing on Hale's arms. "This is disseminated intravascular coagulation. He's not having an allergic reaction. He's been poisoned." The room exploded in voices. Voss was shouting about protocol and proper diagnosis. The generals were demanding answers. Nurses were checking and rechecking monitors. And through it all, Evelyn kept her eyes on Marcus Hale, on the dying man who'd somehow known to ask for her. Then the cardiac monitor alarm screamed and Hale's eyes flew open. His hand shot out with surprising strength, grabbed Voss by the collar, and dragged him down. The room went silent again. "Not him," Hale rasped, his voice like gravel. His eyes, sharp despite the pain, found Evelyn. "Her," and then his heart stopped. Evelyn's body moved before her mind fully processed what was happening. She shoved past Voss, grabbed the defibrillator paddles from the crash cart, and barked orders that cut through the panic like a blade through silk. "Charge to 200. Someone start compressions. You—" She pointed at a young nurse frozen near the IV stand. "Push 1 milligram of epinephrine. Move!" The nurse hesitated, her eyes darting to Voss for confirmation. The chief surgeon stood there, his face flushed with rage and something else. Something that looked almost like fear. He didn't countermand the order, but he didn't support it either. He just stood there, paralyzed by the sudden loss of control. The older general, the one who'd told Voss to step aside, slammed his hand on the bedside table hard enough to make the monitors jump. "Do what she says. Now!" The room erupted into coordinated chaos. A respiratory therapist started chest compressions while Evelyn positioned the paddles. The cardiac monitor showed a flat line that seemed to stretch into eternity. Hale's skin was taking on a waxy quality that Evelyn had seen too many times before. The look of a body shutting down, cell by cell, system by system. "Clear," Evelyn said. Everyone stepped back. The defibrillator discharged with a thump that Evelyn felt in her chest. Hale's body convulsed, arched off the bed, then settled back down. The monitor stayed flat. "Again, 300. The machine whined as it recharged. Evelyn's mind was racing through differentials, through every case she'd ever seen that presented like this. DIC didn't just happen spontaneously, especially not in a healthy military officer. Something had triggered it, something specific. Clear. Another shock, another terrible moment of waiting. Then, a single blip on the monitor. Then another. The rhythm was weak, unstable, but it was there. "We've got sinus rhythm," the respiratory therapist said, his voice tight with relief. But Evelyn wasn't relieved. She was staring at Hale's labs, at the coagulation panel that made no medical sense. "He's going to code again unless we identify the trigger." What medications has he received in the last 24 hours? A nurse pulled up the medication administration record on a tablet. Standard pre-briefing physical. Multivitamin, low-dose aspirin. That's it. No injections, no new supplements? Nothing documented. Evelyn turned to the older general. What about the briefing itself? Was he exposed to anything? Chemicals, biological agents? The briefing was in a secure room, standard air filtration, no environmental hazards. The general's voice was steady, but his eyes were sharp, calculating. You think this was deliberate? It wasn't a question. Evelyn met his gaze and saw a man who'd spent his career reading between lines, who knew when something didn't add up. I think someone gave him something that triggered this cascade. And I think whoever did it knows exactly what they're doing because they chose a presentation that mimics anaphylaxis. Most doctors would treat the symptoms and never look deeper. Voss finally found his voice. This is absurd. You're suggesting a conspiracy based on nothing but based on labs that don't lie, Evelyn shot back. His fibrinogen is at 60. Normal range is 200 to 400. His D-dimer is through the roof. Those numbers don't happen from an allergic reaction. They happen when someone's clotting system has been hijacked. The cardiac monitor started alarming again. Hale's rhythm was deteriorating, the beats coming irregular and weak. Evelyn grabbed the tablet from the nurse and started scrolling through the medical record, looking for anything, any detail that everyone else had missed. And then she saw it. A single line in the nursing notes from 6 hours earlier when Hale had first arrived. Patient received vitamin B12 injection per doctor. Voss's order for reported fatigue. Evelyn's blood went cold. She looked up at Voss, who'd gone very pale. You gave him B12? Evelyn asked quietly. He reported chronic fatigue. It's a standard intervention. Show me the vial. Excuse me? The vial you drew the B12 from. Show it to me. Now. Voss's expression shifted through several emotions too quickly to track. It was disposed of. Standard Sharps protocol. Then show me the lot number from the documentation. The room had gone silent again. Everyone was watching this exchange, sensing the undercurrent of something dangerous. The older general moved closer, his hand resting on his sidearm in a gesture that was probably unconscious, but absolutely threatening. Voss pulled out his phone, fingers moving over the screen. The documentation is in the system. It'll take a moment to... You're stalling, Evelyn said. She turned to the nurse with the tablet. Pull up Dr. Voss's medication orders from today. All of them. The nurse's fingers flew over the screen. Her face went white. There's no order for B12, nothing documented. Voss lunged for the tablet, but the general was faster. He stepped between them, his bulk blocking Voss's path. And in that moment, Evelyn saw the surgeon's carefully constructed facade crack wide open. The arrogance was gone, replaced by something feral and desperate. You gave him an undocumented injection, Evelyn said, her voice steady despite the adrenaline screaming through her system. What was in it? This is insane. I'm a respected surgeon. I've dedicated my career to what? The older general's voice was like iron. Because from where I'm standing, it looks like you tried to kill one of my officers. Hale's monitor alarmed again, louder this time. His blood pressure was dropping, his oxygen saturation falling. Evelyn made a decision that she knew would either save his life or end hers. I need heparin, she said. Every doctor in the room reacted at once. Voss actually laughed, a high, slightly hysterical sound. Heparin? Are you out of your mind? The man is already hemorrhaging at the cellular level, and you want to give him a blood thinner? I want to give him the antidote. Evelyn looked at the general. Sir, I need you to trust me. Whatever Voss gave General Hale, it's causing uncontrolled clotting in his microvasculature. The DIC we're seeing is the body's response. It's consuming all available clotting factors trying to deal with thousands of microscopic clots. If we give him heparin, we stop the clot formation and his system can recover. If you're wrong, Voss said, his voice shaking, you'll kill him in minutes. Evelyn turned to face him fully. If I'm right, you already tried to. The general didn't hesitate. Get her the heparin. Two soldiers who'd been standing silently by the door suddenly moved, blocking the exit. Voss saw it happening and made a break for the hallway, but he was a surgeon, not a soldier. They had him on the ground in seconds, zip-tied and screaming about rights and lawyers and conspiracies. Evelyn tuned it out. She had more important things to focus on. A nurse handed her a vial of heparin and a syringe. Evelyn calculated the dose quickly, enough to anticoagulate, but not so much that it would cause uncontrollable bleeding in a system already on the edge of collapse. Her hands were steady as she drew up the medication, as she injected it into Hale's IV line, as she watched the clear liquid disappear into his bloodstream. Then came the waiting, the terrible, endless seconds where everyone in the room held their breath and watched the monitors. Hale's heart rate stayed erratic. His blood pressure continued to fall. The oxygen saturation dropped to 89%, then 87%. "It's not working," one of the military doctors said. Evelyn ignored him. She was counting in her head, giving the medication time to circulate, to bind, to work. 30 seconds, 45, a full minute. Hale's body went rigid, every muscle locked up in a seizure that made the monitors scream and several nurses cry out in alarm. Evelyn grabbed his shoulders, holding him steady, feeling the violent tremors running through him like electrical current. "Hold him," she shouted. "Don't let him pull the lines out." Hands appeared, nurses, doctors, even one of the soldiers stepping forward to help. They held Hale as his body fought against itself, as whatever chemical reaction Voss had initiated ran its final course. The seizure lasted 20 seconds that felt like 20 years. Then, as suddenly as it started, it stopped. Hale went limp. The room went silent except for the monitors. And those monitors, those beautiful, reliable monitors, started to change. The heart rate stabilized. The rhythm smoothed out into something regular and strong. The blood pressure ticked upward, degree by precious degree. And the oxygen saturation climbed back toward normal range like a drowning man breaking the surface of water. Evelyn let out a breath she hadn't realized she'd been holding. "He's stabilizing," the respiratory therapist said, his voice full of wonder. The older general moved to the bedside, looked down at Hale, then at Evelyn. "How did you know?" "I've seen coagulation cascade disruption before. Years ago, when I was with the mobile surgical units. We had a case where a contractor was exposed to an experimental compound. The presentation was similar." Evelyn pulled off her gloves, her hands finally starting to shake now that the crisis was passing. "I'm guessing Voss gave General Hale something that triggered the same kind of cascade. Something designed to look like natural causes or anaphylaxis. Why would he do that? You'll have to ask him. But I'd start by looking into who's been paying him and what he had to gain from General Hale's death." The general nodded to one of the soldiers, who immediately pulled out a radio and started speaking in low, clipped tones. Within minutes, more military personnel arrived. They cleared the room of everyone except essential medical staff and began what looked like a well-practiced evidence collection protocol. Evelyn found herself standing in the hallway, still in her stained clinic scrubs, watching through the window as soldiers photographed every inch of the room, bagged every medication vial, and documented every piece of equipment. Voss was gone, escorted to some secure location where his explanations would be extracted with considerably less gentleness than he was accustomed to. Marissa appeared at Evelyn's elbow, her face a mixture of shock and vindication. "Holy shit! You just saved General Marcus Hale. The General Marcus Hale." "I just did my job," Evelyn said quietly. "No? You did more than that." Marissa grabbed her arm. "Evelyn, do you understand what you just did? You diagnosed something every other doctor in this hospital missed. You went against Voss. You gave treatment that could have killed the patient if you were wrong. And you were right." Evelyn looked at her friend. "I was lucky." Luck had nothing to do with it. The older general had approached without either of them noticing. Up close, he was even more imposing, 6'4" at least, with shoulders that strained his uniform and eyes that missed absolutely nothing. "Major General William Reeves, Evelyn. Marcus's second in command." The name hit her like a physical blow. "Reeves, as in, Danny Reeves is my nephew, the soldier you saved 6 months ago." Reeves's expression softened fractionally. "He told me what you did, how you bypassed protocol to clamp his femoral artery, how Voss crucified you for it." "I didn't know," Evelyn said. "Marcus did. After Danny told me the story, I told Marcus. And Marcus never forgot a name or a face. When he started feeling ill this morning, When he realized something was wrong, he said your name. Kept saying it, even after he lost consciousness the first time. The medics thought he was delirious. Reeves paused. He wasn't. A nurse emerged from Hale's room. General Reeves? He's asking for someone. He keeps saying a name. Let me guess, Evelyn said. He wants to talk to me. Reeves nodded. Think you can handle one more conversation tonight? Evelyn followed him back into the room. Most of the crowd had dispersed, leaving just a skeleton crew of nurses monitoring the equipment. Hale was awake now, his eyes clear but exhausted. He looked at Evelyn and gave the smallest nod of recognition. Evelyn Cross, he said, his voice hoarse from the intubation tube they'd removed. The nurse who breaks rules. Only when the rules are going to get someone killed, sir. Hale's mouth twitched in what might have been a smile. Voss? He's been on the payroll for 6 months. Defense contractor called Meridian Solutions. They wanted to disrupt our investigation into their weapons testing protocols. Evelyn pulled up a chair. You were investigating them? For illegal human trials, using soldiers as test subjects without informed consent. Hale's eyes hardened. They've been developing a coagulation disruptor, something that could be deployed as a weapon. Causes massive internal clotting that looks like natural death. Hard to detect, harder to trace. And they tested it on you. Voss was supposed to make it look like a heart attack or stroke, something plausible for a man my age. Hale coughed, and a nurse immediately adjusted his oxygen flow. He panicked when I didn't die immediately, started treating me for anaphylaxis to cover his tracks. Reeves crossed his arms. We've had Meridian Solutions under surveillance for 3 months, but we couldn't prove the connection to human testing. Now we can. What happens to Voss? Evelyn asked. Military tribunal, along with everyone else at Meridian who signed off on this. Reeves's expression went cold. They tried to kill a ranking general to protect their profit margins. They're going to learn what happens when you declare war on the wrong people. Hale reached out, his hand shaking but determined, and grasped Evelyn's wrist. You saved my life. Twice over. Once by being good enough at your job that I remembered your name, and once by being brave enough to trust your instincts. I'm just glad you're alive, sir. Don't call me sir. I'm not your commanding officer. Hale's grip tightened slightly. But I'd like to be. Evelyn blinked. I'm sorry. Reeves stepped forward. We need people like you, Evelyn. People who see what others miss. Who aren't afraid to make the hard call. The Military Medical Corps has been looking for experienced critical care nurses to work with special operations units. The pay is better than civilian hospitals. The cases are more challenging, and the bureaucracy, he smiled grimly, is significantly less tolerant of people like Voss. I'm 53 years old, Evelyn said. I just spent 6 months scrubbing dog kennels. I'm not exactly special operations material. You diagnosed a weaponized coagulation disruptor that stumped a room full of doctors. You administered treatment that 99% of medical professionals would have been too afraid to try. And you did it knowing that if you failed, everyone in that room would blame you. Hale's voice was getting stronger. That's exactly the kind of person we need. Evelyn looked at the monitors, at the steady rhythm of Hale's heart, at the numbers that proved he was going to live. Then she looked at Reeves, at the general who'd backed her play without hesitation. And finally she looked at her own reflection in the dark window, a middle-aged woman in stained scrubs who'd been counted out, written off, and dismissed. I need to think about it, she said. Take your time, Reeves replied, but not too much time. We move fast in this world. A commotion in the hallway made everyone turn, voices raised in anger, the sound of someone shouting about rights and access. Then the door burst open and a man in an expensive suit pushed past the soldier trying to stop him. I'm Marcus Hale's personal attorney, the man announced, slightly out of breath. And I'm here to inform you that any medical decisions regarding his care must go through me and the designated medical proxy, Dr. Richard Voss. Voss is in military custody, Reeves said calmly, charged with attempted murder of a federal officer. The attorney went pale. I don't understand. There must be some mistake. No mistake. We have evidence, testimony, and a full confession is expected within the hour. Reeves stepped toward the attorney with the kind of deliberate movement that made it clear this wasn't a negotiation. But since you're here, I have some questions about your client list, specifically your connections to Meridian Solutions. The attorney started backing toward the door. I'm not saying anything without my own legal representation. That's fine. The MPs outside will escort you to a secure location where you can make all the calls you need. Reeves nodded to the soldiers, who moved with practiced efficiency to flank the attorney. We'll talk more soon. As they led the sputtering lawyer away, Evelyn realized the scope of what she'd stumbled into. This wasn't just about Voss trying to kill a patient. This was a conspiracy that reached into defense contractors, military procurement, illegal weapons testing, and who knew what else. And somehow, by doing nothing more than her job, she'd ripped the whole thing open. This is going to get worse before it gets better, isn't it? She said. Hale managed a weak laugh. Welcome to my world, Evelyn. Nothing is ever simple. Over the next hour, the room became a command center. Laptops appeared, satellite phones materialized, and people in various military uniforms arrived to receive orders and deliver briefings. Evelyn stayed mostly out of the way, monitoring Hale's vitals and adjusting his medications as needed. But she listened. She absorbed. She learned. Meridian Solutions had contracts with 3 different military branches. They'd been operating a shadow research program for 18 months, developing weapons banned by international treaty. Voss wasn't their only asset inside medical facilities. He was just the one who'd been caught. There were others, waiting to be identified, ready to test their experimental compounds on unsuspecting soldiers and then cover up the results. How many people have they killed? Evelyn asked quietly, during a brief lull in the activity. Reeves looked up from his laptop. We don't know yet. Could be dozens. Could be more. They're good at making deaths look natural. He paused. But now that we know what to look for, we'll find them. A young intelligence officer appeared with a tablet. Sir, we've got the records from Blackstone Memorial, cross-referencing unexplained deaths in military personnel over the last 18 months with Voss's shift schedules. How many matches? Preliminary count? 14. The number hung in the air like smoke. 14 soldiers, maybe more, dead because a doctor had valued money over lives. 14 families told their loved ones died from natural causes or accidents. 14 cases that might have been prevented if someone had looked closer, asked harder questions, trusted their instincts instead of deferring to authority. Evelyn felt something hard and cold settle in her chest. She'd been fired for saving 1 life. Voss had been celebrated while taking 14. I want to help, she said. Reeves raised an eyebrow. With the investigation? With all of it. The medical corps position, the investigation, exposing everyone involved in this. Evelyn stood straighter. You said you need people who aren't afraid to make hard calls. I just made one. I'm in. Hale smiled, the expression transforming his haggard face into something almost peaceful. Good, because we're going to need you for what comes next. Which is? Meridian Solutions knows we're onto them by now. Voss was their canary in the coal mine. When he doesn't report in, when their attorney gets detained, they're going to start erasing evidence. Hale shifted in the bed, wincing slightly. We have maybe 12 hours before they sanitize everything, which means we need to move fast. What do you need from me? Your medical expertise. We're going to raid their research facility tonight. If we find human test subjects, living or dead, we need someone who can document the evidence properly. Someone who understands coagulation disorders, experimental compounds, and can testify credibly about what they're seeing. Evelyn's mouth went dry. You want me to go on a raid? I want you to do what you do best. Save lives and expose lies. Hale's eyes were sharp despite his exhaustion. But I won't order you. This is volunteer only, and it's dangerous. These people have already tried to kill a general. They won't hesitate to kill a nurse. The room had gone quiet. Everyone was watching her, waiting for her answer. Evelyn thought about Danny Reeves, barely 22, bleeding out from a training accident. She thought about the 14 soldiers on that preliminary list, dead before their time. She thought about every patient she'd ever fought for, every time she'd trusted her training over someone else's authority, every moment she'd chosen to do what was right instead of what was easy. When do we leave? She asked. Reeves's smile was all predator. 2 hours. We'll kit you out with body armor and comms. You'll be embedded with the medical response team, stay behind the tactical operators, document everything you see, and if we find survivors, you keep them alive until we can get them to proper treatment. I can do that. I know you can. Reeves closed his laptop. That's why Marcus asked for you. The next 2 hours passed in a blur of preparation. Evelyn was taken to a secure room where military medical personnel outfitted her with tactical gear. A Kevlar vest that felt impossibly heavy, a helmet with integrated communications, cargo pants with more pockets than she'd ever need. They walked her through the comms system, the hand signals, the protocols for staying safe in a hostile environment. They gave her a medical kit that was like nothing she'd seen in civilian hospitals, packed with combat gauze, tourniquets, hemostatic agents, and medications that could keep someone alive long after civilian medicine would have given up. A female sergeant named Torres ran her through the basics. You stick with the medical team. You don't engage the enemy. You don't play hero. Your job is to stay alive and do your medical work. Understand? Understood. If someone yells, "Get down," you get down. If someone yells, "Move," you move. You don't ask questions. You don't hesitate. The tactical team has been training for this their whole careers. Trust them. Evelyn nodded, trying to absorb everything while her heart hammered against her ribs. You scared? Torres asked, not unkindly. Terrified. Good. Fear keeps you sharp. Just don't let it freeze you. Torres handed her a water bottle. Drink this, stay hydrated, and remember, you've already saved a general's life today. Anything else is just showing off. At 0200 hours, Evelyn climbed into a military helicopter next to Reeves and 5 operators whose faces were painted with camouflage grease. The rotors spun up with a whine that became a roar, and then they were lifting off, rising into the night sky above Greystone City, heading toward a facility that appeared on no public maps, where people were being used as test subjects for weapons that should never have been created. Evelyn looked down at the city lights, at the life she'd known, hospital shifts and patient care, and the simple rhythm of civilian medicine. That world was falling away beneath her, replaced by something darker and more dangerous, but somehow more honest. Here, in this helicopter full of soldiers heading toward violence, there were no politics, no administrators protecting their reputations, no consequences for doing the right thing. The helicopter banked hard, and Evelyn gripped her seat, her stomach lurching. Through the open door, she could see other aircraft in formation, 4 helicopters total, carrying enough firepower to start a small war. 5 minutes, the pilot announced over the comms. Reeves leaned close so Evelyn could hear him over the rotor noise. Last chance to back out. Evelyn thought about Voss, about his sneer when he'd called her a liability, about how he'd looked at her like she was something to be discarded. She thought about the 14 names on that list, soldiers who'd trusted the system to protect them. And she thought about Marcus Hale, dying in that ICU room, using maybe his last breath to say her name. I'm not backing out, she said. The helicopter dropped altitude fast, Evelyn's stomach flipping as they descended toward a cluster of buildings in what looked like an industrial park. Lights blazed in some windows. Others were dark. The facility looked innocuous, just another corporate campus in the middle of nowhere. 30 seconds, the pilot said. The operators checked their weapons with practiced efficiency. Evelyn's hands went to her medical kit, touching each pocket, each piece of equipment, making sure everything was where it should be. Torres had told her to trust her training, to fall back on muscle memory when her brain was too flooded with adrenaline to think clearly. The helicopter flared, rotors screaming, and touched down on a parking lot. Evelyn's door was yanked open, and hands pulled her out into the rotor wash. She stumbled, caught herself, and ran with the medical team toward a building whose front door was already being breached by operators with a battering ram. Gunfire erupted somewhere to her left. Evelyn dropped instinctively, her body remembering training she'd received decades ago during her mobile surgical unit days. Someone grabbed her vest and dragged her forward toward the building entrance through doors that hung twisted on their hinges. Inside was chaos. Emergency lighting, alarms screaming, people running. Operators shouted commands, securing the building room by room. Evelyn followed the medical team deeper into the facility, past offices and conference rooms, toward a section that required keycard access. An operator bypassed the lock with something electronic, and the door clicked open. The smell hit Evelyn first. Antiseptic and death, medical waste and fear. Then she saw the room.
20 beds, maybe more.
Half of them occupied by people in various states of medical distress. IV lines ran into arms, monitors tracked vitals that made Evelyn's blood run cold. These weren't patients receiving treatment. They were test subjects being slowly poisoned while someone documented the results. Jesus Christ, Torres whispered beside her. Evelyn's training took over. She moved to the nearest bed to a young man, couldn't be more than 25, whose skin had the same grayish tint Hales had shown. His chart hung on the bedside, filled with clinical observations written in the cold language of scientific experimentation. Subject 17, Day 4 of compound exposure. Coagulation cascade initiated as expected. Recommend increasing dosage to accelerate timeline. We need to get these people out of here, Evelyn said. Now, they're all dying. Reeves appeared in the doorway, his weapon still raised, sweeping for threats. Can they be moved? They'll die if we leave them. They might die if we move them, but at least moving them gives them a chance. Evelyn was already pulling IV lines, disconnecting monitors, making quick assessments of who could survive transport. I need stretchers, ambulances, and a full trauma center standing by. You'll have it. Reeves spoke into his radio, orders flowing in clipped military efficiency. More medical personnel flooded into the room. Together they began the delicate process of stabilizing patients for transport while operators secured the rest of the facility. Evelyn moved from bed to bed, her hands steady, her voice calm, doing what she'd been trained to do, save lives in impossible circumstances. She was starting an IV on subject 12, a woman in her 30s with petechiae covering her arms, when she heard the explosion. The building shook, lights flickered, and somewhere deeper in the facility, fire alarms began to wail. An operator appeared in the doorway, his face grim. They're destroying evidence. We need to evacuate, now. Evelyn's hands never stopped moving, even as the second explosion rocked the building hard enough to crack the ceiling tiles above her head. She finished securing the IV line on subject 12, taped it down with the kind of speed that came from 16 years of practice, and looked up at Torres. How long do we have? Unknown. They're setting charges throughout the facility. Torres was already helping another medic lift a patient onto a stretcher. Reeves ordered full evacuation. We move everyone we can in the next 3 minutes. 3 minutes to move 20 critically ill patients through a building that was actively being destroyed. The math was brutal and simple. Some of these people wouldn't make it. Evelyn had to choose. She scanned the room with a clinical eye that stripped away emotion and focused only on survival metrics. Subject 17, the young man with advanced coagulation cascade, his vitals were circling the drain, pulse thready, blood pressure barely registering. Moving him would likely kill him, but leaving him guaranteed it. Subject 8, an older woman whose chart showed she'd been exposed to the compound for nearly 2 weeks. Her organs were already failing, multiple systems shutting down. Subject 3, a teenager who couldn't be more than 19, still conscious, eyes tracking movement with desperate awareness. We take the conscious ones first, Evelyn said, her voice cutting through the alarm noise. Anyone who can survive transport for more than 10 minutes. The rest, she swallowed against the thickness in her throat. We make comfortable and come back if we can. Torres nodded grimly. She understood battlefield triage, understood that sometimes saving everyone meant losing everyone. You heard her. Priorities 1 and 2 only. Move. The medical team split into practiced pairs, each taking a patient. Evelyn grabbed the teenager, subject 3, though the chart also listed a name, Michael Chen, and started disconnecting him from the monitors. His hand shot out and gripped her wrist with surprising strength. Are you real? He whispered. Or another test? The question hit Evelyn like a physical blow. How long had this kid been in here, being poisoned and studied, that he couldn't tell rescue from experimentation? I'm real, Michael. My name is Evelyn, and I'm getting you out of here. His eyes filled with tears. They said no one was coming. They said we were volunteers. You're not volunteers, you're victims, and someone's going to pay for what they did to you. Evelyn got him onto a portable stretcher with help from another medic. But right now, I need you to stay calm and keep breathing. Can you do that for me? Michael nodded. Evelyn locked the stretcher wheels and started pushing toward the door, navigating around other medics doing the same desperate dance. Behind her, she heard Subject 17 coding, heard the futile sound of someone trying CPR on a body that was already too far gone. She didn't look back, couldn't afford to. The hallway was filling with smoke. Emergency lighting cast everything in hellish red. Operators moved through the chaos like ghosts, weapons raised, clearing corners and shouting coordinates into their radios. One of them, a massive man with a sergeant's insignia, grabbed Evelyn's stretcher and helped her maneuver around a section of collapsed ceiling. "Stay low," he barked. "They've got shooters in the West Wing trying to slow us down." As if summoning them, gunfire cracked somewhere close. Evelyn dropped instinctively, covering Michael's body with her own. Bullets punched through drywall above their heads, showering them with debris. The sergeant returned fire, his rifle deafening in the enclosed space, and someone screamed, "Move!" he shouted. "Go, go, go!" Evelyn shoved the stretcher forward, running now, her boots slipping on the polished floor. More medics emerged from other rooms, their stretchers laden with the dying. They formed a ragged convoy heading toward the exit, protected by operators who moved with lethal efficiency. Another explosion. This one closer, powerful enough to blow out windows and send glass raining into the hallway. They burst out into the parking lot where helicopters waited, rotors already spinning. The night air was thick with smoke and the chemical smell of burning plastic. Evelyn guided Michael's stretcher toward the nearest helicopter, where a flight medic was waiting to receive patients. "Coagulation disruptor exposure," Evelyn shouted over the rotor noise. "Unknown compound, possibly the same one used on General Hale. He'll need immediate heparin therapy and full coag panel." The flight medic nodded, already checking Michael's vitals. "We'll take good care of him. You did good getting him out." Evelyn wanted to stay, to make sure Michael made it onto the helicopter safely, but Torres was already pulling her back toward the building. "We've got more. 6 still inside, including 2 who might not survive the next 5 minutes without intervention." They ran back into the smoke. The facility was dying around them, structural supports groaning, ceiling tiles falling like snow. Fire had broken out in the eastern section, orange light visible through interior windows. Somewhere deep in the building, another explosion sent a shockwave that Evelyn felt in her chest. The test subject room was worse than when they'd left it. 3 patients remained, the ones Evelyn had mentally labeled as unsalvageable. Subject 17 was dead, his monitor flatlined, no one attempting resuscitation anymore. Subject 8 was unconscious, her breathing shallow and irregular. And in the corner, on a bed Evelyn hadn't noticed before, was Subject 5. A man in military uniform, his face familiar in a way that made her stomach drop. She moved closer, looked at his face, and felt the world tilt. Staff Sergeant David Morrison. She'd worked with him 2 years ago during a training exercise at Blackstone Memorial. He'd been young, healthy, full of the kind of optimism that came from believing the system would protect you. Now he was dying from that same system's betrayal. "Evelyn," Reeves appeared in the doorway, his face streaked with soot. "We have to go. The whole West Wing is about to collapse." "Not without him." Evelyn was already disconnecting Morrison from the monitors, working with the kind of fierce determination that bordered on rage. "He's one of ours. He served this country and they used him like a lab rat. He's not going to make it. Look at his vitals." Evelyn looked. Blood pressure 60/40, heart rate in the 130s, oxygen saturation in the low 80s despite maximum supplemental oxygen. Reeves was right. Morrison was circling the drain, his body shutting down system by system. Moving him would probably kill him. Then he dies in a hospital, not in this fucking place. Evelyn locked eyes with Reeves. "I'm not leaving him." Something shifted in Reeves's expression. He nodded to the 2 operators behind him. "Help her. We've got 2 minutes, maybe less." They got Morrison onto a stretcher as the building shuddered around them. A section of ceiling collapsed in the hallway, blocking their original exit route. Smoke was getting thicker, making it hard to breathe even through the protective masks they'd been issued. Evelyn kept one hand on Morrison's pulse, feeling the weak, irregular flutter beneath her fingers. "Alternate route," one of the operators said, pointing toward a fire exit. "Through the labs."
They moved fast, stretcher wheels rattling over debris. The lab section was a nightmare of broken glass and spilled chemicals, emergency showers running full blast where automated systems had activated. Evelyn glimpsed notebooks on fire, computers smashed, evidence being systematically destroyed even as the building came apart. Then they were through, bursting into another section of parking lot where the remaining helicopters waited. Evelyn helped load Morrison while Torres administered emergency medications, pressors to keep his blood pressure from bottoming out completely, more heparin to fight the coagulation cascade, fluids to replace what he was losing to internal bleeding. "He's not going to make it to the hospital," Torres said quietly. "Then we'll keep him alive anyway." Evelyn climbed into the helicopter beside Morrison's stretcher, her hands already reaching for the medical kit. "Because that's what we do." The helicopter lifted off as the facility's main building collapsed in on itself, a controlled demolition triggered by whoever had decided that destroying evidence was worth killing everyone inside. Evelyn watched through the open door as flames consumed what had been a house of horrors, as operators on the ground continued to secure the perimeter and document what remained. Then she turned her attention to Morrison, to keeping him alive through sheer force of will and medical expertise. The flight to Blackstone Memorial took 8 minutes. Morrison coded twice, his heart stopping, his body giving up. And twice Evelyn brought him back with a combination of drugs, electricity, and something that felt like pure stubborn refusal to let death win. By the time they landed on the hospital roof, her scrubs were soaked with sweat and Morrison's blood, her hands shaking from adrenaline crash. But he was alive. The trauma team was waiting, led by Dr. Patel from oncology, who'd apparently been pulled in to coordinate the mass casualty response. He took one look at Evelyn and whistled low. "You look like you've been through a war." "Feels like it." Evelyn helped transfer Morrison onto the hospital gurney. "Experimental coagulation disruptor, same compound as General Hale. He needs immediate heparin therapy, fresh frozen plasma, and continuous monitoring for DIC progression." Patel nodded, already directing his team. Morrison disappeared into the hospital, surrounded by doctors and nurses who would continue the fight Evelyn had started. She stood on the roof, watching them go, feeling the weight of the last 6 hours settle onto her shoulders like a physical thing. More helicopters were landing, bringing in the other survivors. 11 had made it out alive. 9 had died in the facility, their bodies left behind in the fire. The math was brutal, but it was better than the alternative, better than letting all of them die in silence, their murders covered up and forgotten. Torres appeared beside her, offering a bottle of water. "You should get checked out. You took some hard hits back there." Evelyn hadn't noticed, but now that Torres mentioned it, she could feel the bruises forming, the ache in her ribs where she'd been slammed against a wall during the evacuation. "I'm fine." "You're not fine. You're running on adrenaline and stubbornness." Torres smiled tiredly. "But I get it. The work's not done yet." They took the elevator down to the ICU level, where organized chaos reigned. The 11 survivors were being distributed across multiple rooms, each one requiring intensive care and constant monitoring. Evelyn moved between them, offering expertise where she could, checking labs, adjusting medication dosages, being the kind of nurse she'd always been, competent, thorough, unwilling to accept defeat. She was reviewing Subject 12's updated coagulation panel when Marissa found her. "Evelyn, you need to see this." Marissa led her to a conference room that had been converted into a command center. Laptops covered every surface, cables snaking across the floor, military personnel clustered around screens displaying data that Evelyn didn't fully understand. But what she did understand was the evidence being compiled, financial records, email chains, video footage from the facility's security cameras. Reeves stood at the center of it all, coordinating the investigation with the same precision he'd used to coordinate the raid. He looked up when Evelyn entered. "We've got them," he said simply. "Meridian Solutions, their entire executive board, the shareholders who funded the research. We've got documentation of the human trials, the payoffs to hospital staff, everything." "Voss?" Evelyn asked. "Singing like a canary. Gave us names, dates, wire transfer records. He's trying to cut a deal, but there's not going to be one. Not for this." Reeves pulled up a document on the nearest laptop. 14 soldiers confirmed dead from the coagulation disruptor.
another 7 from other experimental compounds. And those are just the ones we can prove. The real number is probably higher. Evelyn felt sick. 21 people, minimum, murdered in the name of weapons development and profit. What happens now? She asked. Now we build the case. Federal prosecutors are already assembling grand juries. The military is conducting its own investigation into procurement fraud and conspiracy to commit murder. And you, Reeves looked at her with something like respect, you're going to be our star witness. Me? You diagnosed what no one else could. You saved General Hale's life. You risked your own life to extract test subjects from a hostile facility. Your testimony is going to put these people away for the rest of their lives. Reeves paused. But it's also going to make you a target. The words hung in the air. Evelyn thought about the attorney who'd burst into Hale's room, about the shooters in the facility trying to slow down the evacuation, about the people who'd decided that destroying evidence was worth killing 20 people. They're going to come after me, she said. Not a question. We think so, yes. Meridian Solutions has too much money and too many connections to go down quietly. They'll try to discredit you, intimidate you, maybe worse. Reeves crossed his arms. We can offer protection, safe house, armed guards, new identity if necessary. Evelyn laughed, the sound bitter. 6 months ago, I was fired for saving a soldier's life. Now I need a new identity because I saved a general. 6 months ago, you were exactly who you are now, someone who refuses to compromise when lives are at stake. The only thing that's changed is that the right people finally noticed. A commotion in the hallway interrupted them. Raised voices, the sound of something breaking. Reeves's hand went to his sidearm as operators moved toward the door. Then Evelyn heard a voice she recognized, and her blood went cold. Dr. Richard Voss, screaming about lawyers and rights and conspiracies. She moved to the doorway, looked out, and saw Voss being dragged down the hallway in zip ties by 2 MPs. But he wasn't being taken out of the hospital. He was being brought toward the conference room, his expensive shoes squeaking on the polished floor, his face red with rage and fear. The MPS shoved him into a chair. Voss looked around wildly, saw Evelyn, and something in his expression changed. The fear became calculation, became desperate bargaining. You, he said, his voice shaking. You have to tell them I didn't know. The compound. I thought it was just a vitamin supplement. They told me it was safe. Evelyn stared at him. You documented 14 deaths, Richard. You wrote clinical notes about their symptoms, their suffering. You knew exactly what you were doing. I was following orders. Meridian Solutions said it was approved research, that the subjects had all consented. Michael Chen is 19 years old. He thought he was volunteering for a nutrition study. Instead, you poisoned him and watched him die by inches. Evelyn's voice was steady, cold. You don't get to pretend you're a victim now. Voss lunged forward, but the MPs held him back. You self-righteous bitch. You act like you're better than me, but you broke protocol too. You performed a surgical procedure without authorization. You're no different. I saved a life. You ended 21 of them. We are nothing alike. Reeves stepped forward. Dr. Voss, you're being transferred to a military detention facility where you'll await trial. The charges include murder, conspiracy to commit murder, fraud, and treason. Your medical license has been permanently revoked. Your assets have been frozen. And your cooperation, while noted, will not result in any reduction of charges. You can't do this. I have rights. I'm a civilian. You murdered a federal officer and conducted illegal weapons research. That makes you an enemy combatant. Reeves nodded to the MPs. Get him out of here. They dragged Voss away, his protests echoing down the hallway until a door slammed shut and cut off the sound. Evelyn stood there, feeling nothing, no satisfaction, no vindication, just a hollow exhaustion that went bone deep. You okay? Marissa asked softly. No, but I will be. Evelyn turned back to the conference room, to the evidence covering every surface, to the proof that sometimes the system did work. Slowly, imperfectly, but it worked. How are the survivors doing? Morrison's holding steady. They've got him on maximum support, but his vitals are improving. The others, Marissa consulted her tablet. 6 are stable, 3 are critical, but improving. 2 are touch and go. I want to check on them. Evelyn, you've been awake for almost 24 hours. You need rest. I'll rest when they're stable. Evelyn headed for the door, but Reeves caught her arm. There's something else you need to know, he said quietly. We found another facility. Meridian Solutions has been running parallel experiments at a site in Nevada. Different compound, same methodology. We're planning a raid for tomorrow night. Evelyn looked at him. You want me there. I want you wherever you want to be. But if you're there, we save more lives. You've proven that twice now. The weight of it settled on Evelyn. The knowledge that her expertise, her willingness to break rules and trust her instincts made her uniquely valuable. She could walk away now, could accept protection and a safe house, and let someone else fight this battle. Or she could keep going, could put herself in danger again, could continue doing what she'd always done. It wasn't really a choice at all. What time do we leave? She asked. Reeves smiled. 0400. Get some rest. You've earned it. Evelyn made her rounds through the ICU, checking on each survivor, adjusting medications, speaking quietly with the nurses who'd taken over their care. Morrison was in room 6, surrounded by monitors and machines keeping him alive. Evelyn stood in the doorway, watching his chest rise and fall, watching the numbers on the screen that said he was winning his fight by the smallest of margins. He's going to make it, Dr. Patel said, appearing beside her. Thanks to you. Thanks to all of us. No, thanks to you. Patel handed her a tablet showing Morrison's latest labs. His coagulation panel is normalizing. The heparin therapy worked. You were right about the diagnosis, right about the treatment, right about everything. Evelyn studied the numbers, feeling something like peace settle over her. I was lucky. You were brilliant and brave, and exactly the kind of nurse this hospital should have protected instead of firing. Patel's voice turned bitter. I tried to speak up for you during the disciplinary hearing. So did a few others. But Voss had too much power, and the administration was too afraid of lawsuits. It's in the past. Is it? Because the hospital board has been in emergency session for the last 3 hours. Word is they're trying to figure out how to handle the PR nightmare of having fired the woman who saved General Marcus Hale and exposed a military conspiracy. Patel smiled grimly. I heard they want to offer you your job back. I don't want it. Good. You deserve better than this place. Patel squeezed her shoulder. Whatever you decide to do next, you'll have my recommendation and my respect. Evelyn left the ICU as dawn was breaking over Greystone City. She walked through the hospital corridors she knew so well, past the locker room where she'd been escorted out 6 months ago, past the entrance where Voss had sneered at her. The building looked the same, but everything had changed. She found an empty on-call room and collapsed onto the narrow bed, still in her blood-stained tactical gear, too exhausted to change. Sleep hit her like a freight train, dragging her down into darkness where she dreamed of explosions and cardiac monitors and the faces of people she'd saved and people she'd failed to save. When she woke, it was late afternoon. Someone had left a tray of food outside the door, hospital cafeteria fare, but she was hungry enough not to care. She ate mechanically, showered in the small attached bathroom, and changed into clean scrubs that someone had thoughtfully provided. Her phone had 17 missed calls and 43 text messages. Most were from Sarah, her daughter, who'd apparently seen the news coverage of the Meridian Solutions raid. Evelyn called her back, spent 20 minutes reassuring her that she was fine, yes, really fine, and no, she didn't need Sarah to fly out from Seattle. Mom, you raided a weapons facility, Sarah said, her voice tight with worry. That's not normal nurse stuff. I'm not a normal nurse anymore. The words surprised Evelyn, but they felt true. I'm something else now. I'm not sure what yet. As long as you're safe. I'm safe. I promise. Evelyn ended the call and looked at herself in the mirror. The woman staring back had bruises forming on her cheekbone, circles under her eyes, and a look of determination that hadn't been there 6 months ago. She'd been broken down, written off, discarded, and she'd come back stronger. Her phone buzzed with a new message. Reeves. Briefing at 2100 hours. Nevada raid is a go. You still in? Evelyn typed her response without hesitation. I'm in. She spent the remaining hours reviewing files on the Nevada facility, studying the compound they were developing there. something that targeted the nervous system instead of the coagulation cascade. The test subjects showed symptoms consistent with rapid onset ALS, their bodies shutting down from the outside in. The cruelty of it made her sick. The briefing was held in a secure room off the main hospital. Reeves laid out the tactical plan while Evelyn absorbed details about the facility's layout, the expected resistance, the medical protocols for handling contaminated subjects. This raid would be bigger than the first one. More operators, more resources, more risk. Intel suggests they've got at least 30 test subjects on site, Reeves said, pointing to a schematic on the screen. Most of them military personnel who thought they were participating in approved studies. We're going in with the assumption that some subjects may be hostile. The neurological compound can cause paranoia and aggression. What's the extraction plan? Evelyn asked. Fast and surgical. We breach at multiple points, secure the test subjects, and evacuate before they can destroy evidence. You'll be with Medical Team Alpha, coordinating triage and treatment protocols. Reeves looked at her. This is going to be worse than the last one. The subjects have been exposed longer, their conditions are more advanced. We might not be able to save all of them. Then we save who we can. The meeting broke up near midnight. Evelyn was heading back to the on-call room when she heard footsteps behind her. She turned to find Marcus Hale standing in the hallway, looking remarkably alive for someone who'd been dying 48 hours ago. He was in a hospital gown and robe, an IV pole beside him, but his eyes were clear and sharp. You should be in bed, Evelyn said. So should you. Heard you're going to Nevada. Someone has to look after the test subjects. Hale moved closer, his movements careful but steady. Evelyn, these people, Meridian Solutions, they're not going to stop. Even with Voss in custody, even with the evidence we've gathered, they have resources we're only beginning to understand. Going on another raid puts you directly in their crosshairs. I know. And you're going anyway. I didn't save your life just so I could hide when things get dangerous. Evelyn met his gaze steadily. This is what I do now. This is who I am. Hale studied her for a long moment. Then he nodded slowly. Reeves told me you accepted the position with the medical corps. When all this is over, when the trials are finished and Meridian Solutions is dismantled, you'll have full autonomy to build your own team. No bureaucracy, no administrators second-guessing your decisions. Just good medicine and people who trust your judgment. That sounds too good to be true. It's real. I promise you that. Hale's expression softened. You saved my life because you were willing to trust your instincts over the rules. That's the kind of thinking we need. That's the kind of person who changes systems instead of being crushed by them. Before Evelyn could respond, alarms started screaming throughout the hospital. Not fire alarms, security alarms, the kind that meant an active threat. Operators appeared from nowhere, weapons drawn, moving with purpose toward the main entrance. Reeves's voice crackled over the hospital's PA system. Lockdown protocols activated. All personnel to secure positions. This is not a drill. Evelyn and Hale exchanged looks. Then they heard the gunfire. It came from the main lobby, multiple weapons firing in sustained bursts. Glass shattered. People screamed. And Evelyn realized with cold clarity that Meridian Solutions hadn't waited for the Nevada raid. They'd brought the war here, to Blackstone Memorial, where 11 survivors could testify against them and one nurse knew too much. They'd come to erase the evidence, and they'd come to kill her. Evelyn's first instinct was to run toward the gunfire, toward the ICU, where 11 vulnerable patients lay connected to machines and monitors. Hale grabbed her arm with surprising strength for someone who'd been intubated 2 days ago. No, they want you to do exactly that. His voice was sharp, commanding. They'll be watching the ICU, waiting for you to come protect your patients. I can't just leave them. The operators will handle it. You need to stay alive long enough to testify. Hale pulled her toward a staff stairwell, moving faster than his condition should have allowed. Reeves told me about the Nevada raid. If you die tonight, those 30 test subjects have no one who understands how to save them. The logic was sound, but it felt like abandonment. Evelyn let Hale pull her into the stairwell as more gunfire echoed through the hospital. She could hear boots pounding on the floors above and below, operators moving to intercept the attackers. The security alarms created a wall of sound that made thinking difficult. They descended 2 flights before Hale stopped, pressing a hand to his chest. His face had gone pale, sweat beading on his forehead. The exertion was too much for a body still recovering from near death. "I'm fine," he said before Evelyn could speak. "You're not fine. Your heart rate is probably 140, and your surgical incisions are going to start bleeding if you keep pushing." Evelyn grabbed his IV pole before it could tip over. "We need to find somewhere secure where you can rest." "There." Hale pointed to a door marked Radiology. "Staff only." "Those rooms are lead-lined. Bullets won't penetrate." They slipped into the radiology department, which was dark and empty at this hour. Evelyn guided Hale to a chair in the staff lounge and checked his pulse. Fast, but steady, stronger than she'd expected. The man had been through wars. He knew how to function on a body that was damaged but not defeated. "Stay here," Evelyn said. "I'm going to check the security feeds, see what we're dealing with." She found a computer terminal and logged in using the credentials she still technically had from her firing. The hospital's IT department apparently hadn't bothered to deactivate her account. The security camera system came up, showing multiple feeds from throughout the building. What she saw made her stomach drop. 6 attackers in tactical gear had breached the main entrance, using explosives to blow through the security checkpoint. They'd killed 2 security guards and wounded several civilians before operators engaged them in the lobby. But they were just the distraction. 3 more attackers had entered through the emergency department loading dock, moving with purpose toward the ICU wing, and 2 others, these in civilian clothes, harder to spot, were using the service elevators to access the upper floors. 11 attackers total. All heavily armed, all moving with military precision towards specific targets. "They're going for the survivors first," Evelyn said, watching the feeds. "The test subjects who can testify about what Meridian Solutions did." Hale appeared beside her, steadier now that he'd caught his breath. "And then they'll come for you. Kill the witnesses, destroy the evidence, make it look like a random terrorist attack." On screen, operators engaged the 3 attackers heading toward the ICU. The firefight was brutal and close quarters, bullets tearing through walls and medical equipment. Evelyn watched a nurse she recognized, Angela from the night shift, get caught in the crossfire. The woman went down hard, clutching her shoulder, and Evelyn felt rage replace fear in her chest. "I have to help them," she said. "You help them by staying alive and making sure the people who ordered this attack face justice." Hale pointed to another feed. "Look, Reeves has the ICU locked down. 3 operators inside, full defensive positions. The survivors are being moved to the basement level through the utility corridors." The feed showed stretchers being rushed through narrow hallways by nurses and operators working in tandem. Morrison was one of them, still unconscious but alive, being guided to safety by people who understood the stakes. It was coordinated, professional, the kind of emergency response that saved lives. But it wasn't enough to save everyone. On another feed, Evelyn watched one of the civilian-clothed attackers reach the 4th floor, the administrative wing where all the evidence from the raid had been stored. He pulled out a device that looked like a tablet, pressed several buttons, and the entire corridor erupted in flames. Thermite, Evelyn realized. They were using thermite grenades to destroy documents, computers, anything that could be used against Meridian Solutions in court. "They're erasing everything," she said quietly. Hale's jaw tightened. "Not everything. We've got digital backups at 3 separate military facilities. But the physical evidence, the original documents, those are irreplaceable. The defense will argue the digital files were fabricated." More explosions rocked the building. The lights flickered, died, then came back on as emergency generators kicked in. Evelyn's phone buzzed with a text from Reeves. "Where are you?" She texted back her location. The response came immediately. "Stay there. Operators en route to secure your position. Do not engage." "I'm not a soldier," Evelyn said. "I'm a nurse. What do they think I'm going to do? Fight off trained mercenaries with a stethoscope?" Hale smiled grimly. "You've already fought them with something more dangerous. The truth. That's why they're so desperate to kill you." The door to the radiology department burst open. Evelyn spun, her heart leaping into her throat. But it was Torres and 2 other operators. They moved quickly into the room, weapons raised, clearing corners with practiced efficiency. "We're evacuating you," Torres said. "Choppers on the roof. We move now." "What about the patients?" Evelyn asked. "Being handled. Your job is to survive. Torres grabbed Evelyn's arm with a grip that left no room for argument. Let's go. They moved through the hospital in a tactical formation. Torres on point, Evelyn and Hale in the middle, two operators bringing up the rear. The building felt different now, transformed from a place of healing into a battlefield. Smoke drifted through hallways, emergency lighting cast everything in red, and the sounds, gunfire, explosions, alarms, screams, created a soundtrack that belonged in a war zone, not a hospital. They took the service stairs to the roof, climbing 7 flights while operators radioed coordinates and threat assessments. Evelyn could hear fighting on multiple floors, could feel explosions rattling the stairwell. Hale kept pace, his breathing labored but steady, refusing to slow them down. The roof access door was already open, held by 2 more operators who'd secured the helicopter landing pad. A Black Hawk sat with rotors spinning, ready for immediate departure. Torres hustled Evelyn toward it, but she pulled back when she saw who was already inside. Michael Chen, the 19-year-old she'd pulled from the facility. He was conscious now, sitting up on a medical stretcher, eyes wide with terror as explosions lit up the night sky behind him. Beside him were 4 other survivors from the raid, all in varying states of consciousness, all vulnerable and afraid. "You're bringing them?" Evelyn asked. "Can't leave them here to die," Torres said. "They're going to a secure military medical facility. You're going with them." Evelyn climbed into the helicopter, immediately moving to check on the survivors. Michael grabbed her hand. "It's happening again," he whispered. "They're trying to kill us again." "Not this time." Evelyn squeezed his hand. "You're safe now, I promise." The helicopter lifted off as Blackstone Memorial burned below them. Evelyn watched through the open door as flames consumed the administrative wing, as operators fought room-to-room battles against attackers who'd rather die than be captured. She saw police cars and fire trucks arriving, saw crowds of civilians being evacuated into the street, saw the organized chaos of a hospital under siege. And she saw one more thing, a black SUV pulling away from the emergency department loading dock, driving too fast, running red lights as it disappeared into the city. "They're escaping," she said, pointing. Torres followed her gaze, spoke into her radio. "We've got a vehicle fleeing south on Mercy Boulevard, black SUV, no plates visible, requesting intercept." The response crackled back. "Negative. All ground units engaged at the hospital. Air support is 20 minutes out." "They're going to get away," Evelyn said. Hale leaned forward, looked at the fleeing vehicle, then at the helicopter pilot. "Can you follow them?" The pilot glanced back. "Sir, my orders are to evacuate these civilians to—" "I'm a 3-star general, and I'm ordering you to follow that vehicle." Hale's voice left no room for argument. "Those people just attacked a hospital and killed American citizens. We're not letting them disappear." The pilot hesitated for maybe 2 seconds, then banked the helicopter hard. Evelyn grabbed a strap to keep from sliding as they descended, rotors screaming, chasing the SUV through the streets of Greystone City. Torres immediately began arguing. "Sir, we have wounded civilians on board. We can't engage in a high-speed pursuit. The wounded are stable, and if we let these attackers escape, Meridian Solutions will claim they had nothing to do with tonight's assault. They'll say it was random terrorism, and our entire case falls apart." Hale was already checking the rifle of the nearest operator. "How many rounds you got?" 30-round mag, sir. 2 more as backup." "Good. Get on the door gun." Things moved very fast after that. The operator positioned himself at the open door with what Evelyn now recognized as an M240 machine gun. Torres was still protesting, but she was also coordinating with ground units, trying to get police to intercept the SUV before things got even more chaotic. The helicopter screamed through the city at dangerous speeds, maybe 50 feet above the streets, close enough that Evelyn could see people pointing up in shock. The SUV was weaving through traffic, sideswiping cars, clearly desperate to escape. It turned onto a highway on-ramp, accelerating hard. "They're headed for the interstate," the pilot said. "Once they're in heavy traffic, we lose them." "Not acceptable." Hale looked at Evelyn and the survivors. "Hold on to something." The helicopter dropped lower, flying parallel to the highway now, pacing the SUV. Evelyn could see faces in the vehicle. 3 people, all wearing tactical gear, one of them holding what looked like a radio. They were coordinating with someone, probably reporting back to whoever had ordered the hospital attack. The operator on the door gun opened fire. Bullets tore into the SUV's engine block, sparks flying as metal shredded. The vehicle swerved wildly, smoke pouring from under the hood. But the driver kept it under control, kept accelerating, refusing to stop. Engines hit, but they're still moving, the operator reported. Take out the tires, Hale said. More gunfire. The SUV's rear tires exploded, shredded by high-caliber rounds. The vehicle fishtailed, the driver fighting for control, and then made a decision that was either incredibly brave or incredibly stupid. He aimed directly for a concrete highway divider and gunned the engine. The SUV hit the divider at 60 miles per hour, launched into the air, and flipped. It rolled 3 times, shedding parts and glass, and at least one passenger who was thrown clear. When it finally stopped, it was upside down and on fire. The helicopter circled while police cars screamed up, surrounding the wreck. Evelyn watched as first responders pulled 2 survivors from the burning vehicle, both unconscious, both badly injured. The third occupant, the one who'd been thrown clear, wasn't moving. "Set us down," Hale ordered. "Sir, this is an active crime scene. Set us down or I'll court-martial you for refusing a direct order." The pilot landed in the middle of the highway, rotors still spinning, while police established a perimeter. Hale climbed out, moving stiffly but with authority, and Evelyn followed despite Torres's protests. She was a nurse. There were injured people. The rest was just noise. The driver and passenger from the SUV were both critical, massive trauma, probable internal bleeding, the kind of injuries that killed people if they didn't get immediate care. Paramedics were already working on them, but Evelyn saw mistakes being made, saw treatment priorities that were wrong. "You're wasting time on the passenger," she said, kneeling beside the paramedics. "He's got a tension pneumothorax. His lung is collapsed and pushing his heart to the side. He'll code in the next 2 minutes if you don't decompress his chest." The paramedic looked at her, started to argue, then saw Torres and the other operators standing behind Evelyn with very large guns. He handed her a large bore needle. Evelyn found the correct intercostal space, inserted the needle between the ribs, and was rewarded with a rush of air as the pressure released. The passenger's color immediately improved, his oxygen saturation climbing back towards survivable levels. "Get him to a trauma center," Evelyn said, "and make sure he's under police guard. He just participated in a terrorist attack on a hospital." The driver was in worse shape. Internal injuries so severe that Evelyn doubted he'd survive transport, but he was conscious, barely, his eyes focusing on her face with surprising clarity. "You're the nurse," he rasped. "The one they sent us to kill." Evelyn leaned closer. "Who sent you? Give me a name." The driver coughed, blood on his lips. "Doesn't matter. They'll send more. You can't stop this." "Watch me." Evelyn held his gaze. "Your friends are in custody. Your operation failed, and everyone who ordered this attack is going to prison for the rest of their lives. You died for nothing." Something flickered in the driver's eyes. Regret, maybe, or just the awareness of failure. Then his pupils dilated, his breathing stopped, and he was gone. Evelyn stood, her scrubs now covered in his blood on top of everything else, and found Hale standing with a police lieutenant who looked completely overwhelmed by the situation. "General Hale says this is connected to the hospital attack," the lieutenant was saying, "but I need to understand jurisdiction here. This is a civilian highway, and this is a federal case involving military personnel and national security," Hale interrupted. "Your officers did excellent work stopping this vehicle, and we'll need their statements, but the suspects are now in military custody." "One of them is dead," Evelyn said quietly. Hale nodded. "Then we focus on the 2 survivors. Get them medical treatment, keep them alive, and extract everything they know about Meridian Solutions." The lieutenant looked like he wanted to argue, but Hale's presence, combined with the helicopter full of armed operators, made it clear this wasn't a negotiation. Within minutes, the 2 surviving attackers were loaded into ambulances with military escorts, headed for the same secure facility where Voss was being held. Evelyn climbed back into the helicopter, exhausted beyond measure. Michael Chen was crying silently, tears running down his face as he processed what he'd just witnessed.
She sat beside him, took his hand, and didn't say anything. Sometimes there were no words for the horror, no comfort that made it better. Sometimes you just had to sit with someone and let them know they weren't alone. The flight to the military medical facility took 20 minutes. Evelyn spent the time checking on each survivor, adjusting IV rates, monitoring vitals, doing the work that kept her grounded when everything else was chaos. Torres sat across from her, silent now, her expression unreadable. When they landed, a full medical team was waiting. The survivors were transferred to secure rooms where they'd receive treatment and protection. Evelyn tried to follow, but Torres blocked her path. "You need to be debriefed," Torres said. "Intelligence wants to know everything you saw, everything that driver said before he died. The patients The patients are being cared for by competent medical professionals. You need to do your part." Torres's voice softened slightly. "I know you want to keep working. I know that's how you deal with stress. But right now, the most important thing you can do is help us build the case against the people who ordered tonight's attack." Evelyn let herself be led to a conference room where Reeves was already waiting, along with several people in suits who identified themselves as federal prosecutors and military intelligence officers. They sat her down, gave her coffee she didn't drink, and asked her to recount everything that had happened from the moment the alarms started. She told them about the security feeds, about the thermite grenades destroying evidence, about the SUV fleeing and the driver's final words. One of the intelligence officers made notes while another recorded the conversation. It felt clinical, detached, nothing like the visceral reality of watching people die. "The driver said they'd send more," one of the prosecutors noted. "Did he specify who they were?" "No, but the implication was clear. Meridian Solutions has more assets, more people willing to kill to protect their interests." Evelyn finally took a sip of the coffee, grimaced at the bitter taste. "How many did we lose tonight?" Reeves's expression darkened. 4 security guards dead, 2 police officers, 3 civilians caught in the crossfire, 11 hospital staff injured, including 1 critical, and we lost one of the survivors from the original raid, Subject 8. She coded during the evacuation and couldn't be revived. Evelyn closed her eyes. Subject 8, the older woman whose organs had already been failing. She'd known the woman probably wouldn't survive, but knowing didn't make it hurt less. "The other 10 survivors are stable and secure," Reeves continued. "Morrison is awake and asking for you. The kid, Michael Chen, wants to give a statement while the memories are fresh." "What about the hospital?" "Structural damage to 3 wings. The administrative section is a total loss. They used thermite on every room where evidence was stored, but we'd already digitized most of the critical documents and transferred them off-site." Reeves pulled up images on his laptop. "We also recovered something interesting from the attackers." The images showed military-grade communications equipment, encrypted phones, and what looked like mission briefings. But one image made Evelyn lean forward, a photograph, printed on glossy paper, showing her face circled in red. "They had targeting packages," one of the intelligence officers explained. "You, General Hale, Major General Reeves, the survivors from the raid, all marked for elimination." "How did they get photographs this recent?" Evelyn asked. "I've barely been visible in public since this started." "Someone inside the hospital took them." Reeves pulled up another image, security footage showing a nurse Evelyn didn't recognize, using her phone to photograph patients in the ICU. "We caught her trying to leave during the attack. She's been feeding information to Meridian Solutions for the past 8 months." Evelyn felt sick. A nurse, someone who'd taken the same oath she had, selling out patients for money. "Has she talked?" "Extensively. She gave us names of other informants, details about Meridian's surveillance network, and confirmation that tonight's attack was ordered directly by the company's CEO, Nathan Cross." The name hit Evelyn like a physical blow. "Nathan Cross is my ex-husband." The room went silent. Reeves stared at her. "You were married to the CEO of Meridian Solutions?" 20 years ago. We divorced when he started prioritizing profit over ethics. I took back my maiden name, moved across the country, tried to forget he existed." Evelyn's hands were shaking. "I had no idea he was involved in defense contracting. Last I heard, he was working in pharmaceutical sales." The prosecutors exchanged looks. One of them, a woman with sharp eyes and graying hair, leaned forward. Ms. Cross, this changes the dynamic considerably. The defense will argue you have a personal vendetta against Nathan Cross. They'll say you fabricated evidence to destroy your ex-husband's company. I didn't even know he owned Meridian Solutions until 5 seconds ago. That doesn't matter. What matters is how it looks to a jury. The prosecutor tapped her pen against her notepad. We need to be very careful about how we use your testimony. If the defense can paint you as biased or motivated by revenge, then we corroborate everything with other witnesses, Reeves interrupted. We've got Voss, we've got the nurse who was spying for them, we've got the 2 surviving attackers from tonight. Evelyn's testimony is just one piece of a much larger case. It's the most visible piece. She saved General Hale's life. She diagnosed the coagulation disruptor. She participated in the facility raid. The media is going to make her the face of this case, and when they discover her connection to Nathan Cross, they discover it from us, on our terms. Hale appeared in the doorway, looking better than he had any right to after the night's chaos. We hold a press conference. We lay out the facts. We show the American people exactly what Meridian Solutions did, and we make it clear that Evelyn Cross is a hero, not a vengeful ex-wife. The prosecutor looked skeptical. General, with respect, that's a significant risk. If the press conference goes badly, then it goes badly, but I'm not letting these people win by making us afraid to tell the truth. Hale moved into the room, and despite the hospital gown and IV pole, he commanded absolute authority. Nathan Cross ordered an attack on a hospital. He murdered federal officers. He conducted illegal human experimentation on American soldiers. Those facts don't change regardless of who he used to be married to. Evelyn found her voice. When is this press conference? Tomorrow morning, 0900 hours. Hale looked at her steadily. You don't have to participate if you don't want to, but it would help if you did. She thought about Nathan, about the man she'd married when she was young and idealistic, before she'd realized he cared more about money than people. She thought about their divorce, about his threats to destroy her career if she ever spoke publicly about his business practices. She thought about 20 years of silence, of letting him win because fighting seemed too expensive. I'll do it, she said. The rest of the night passed in a blur of preparation. Communications specialists coached Evelyn on how to handle hostile questions. Lawyers reviewed every statement to ensure nothing would compromise the criminal case, and military intelligence provided background briefings on Meridian Solutions, its contracts, its executives, its web of corruption that reached into 3 branches of military procurement. Nathan Cross had built an empire on selling weapons to the government, and when traditional weapons stopped generating sufficient profit, he'd turned to experimental compounds. The coagulation disruptor was just one product in a pipeline that included nerve agents, psychological warfare chemicals, and genetic modification research. All of it illegal. All of it tested on unwitting human subjects. He's going to fight this with everything he has, Reeves warned. His legal team includes some of the best defense attorneys in the country. They'll attack your credibility, your medical judgment, your motives. Are you ready for that? I've been attacked by worse, Evelyn said quietly. At least this time I'm fighting back. At 0500 hours, Evelyn finally allowed herself to sleep, collapsing into a bed in the officers' quarters. She dreamed of explosions and cardiac monitors and Nathan's face, young and smiling, before she'd realized what kind of man he really was. When she woke 3 hours later, the press conference was 90 minutes away. She showered, dressed in a clean uniform someone had provided. Not scrubs this time, but a formal military service dress that made her look official and competent. A makeup artist helped cover the bruises on her face, though Evelyn secretly thought the bruises told a better story than any cosmetics could. The press conference was held in a military facility's main briefing room. Evelyn stood backstage with Hale and Reeves, watching as reporters filed in. Local news, national networks, military journalists, even international press. The story had gone global overnight. Hospital attack linked to defense contractor was trending on every news platform. You're going to do fine, Hale said. Just tell the truth. Evelyn nodded, her throat tight. Through a gap in the curtain, she could see the podium, the cameras, the hungry faces of reporters who wanted a story that would make careers. And in the front row, dressed in an expensive suit and surrounded by lawyers, sat Nathan Cross. He looked older than she remembered, gray at the temples,
but still handsome in the way that men with money and power often were. He was smiling slightly, confident, unbothered by the allegations. When he saw her looking, he winked. The gesture was so casual, so dismissive, that Evelyn felt something cold settle in her chest. He thought he was going to win, thought his lawyers and his money would protect him like they always had, thought she was still the young nurse who'd walked away from their marriage rather than fight. He was about to learn how wrong he was. The press conference began with Reeves reading a prepared statement outlining the charges against Meridian Solutions. Then Hale spoke about the attack on the hospital, about the brave operators and medical personnel who'd prevented a massacre. And then it was Evelyn's turn. She walked to the podium on legs that felt steadier than they had any right to. The cameras focused on her face, and she looked directly into them, directly at the millions of people watching. "My name is Evelyn Cross," she began. 6 months ago, I was fired from Blackstone Memorial Hospital for saving a soldier's life. Tonight, I'm here because that same hospital was attacked by mercenaries working for a defense contractor that views human lives as expendable resources. She paused, let that sink in. In the front row, Nathan's smile faltered. "I want to tell you about a 19-year-old named Michael Chen. He thought he was volunteering for a nutrition study. Instead, he was poisoned with an experimental compound designed to cause massive internal bleeding. I want to tell you about Staff Sergeant David Morrison, who survived 3 tours in combat zones only to be used as a test subject by the people he'd sworn to protect. I want to tell you about 14 soldiers who died because a doctor at Blackstone Memorial, a doctor I worked alongside for years, valued money more than the Hippocratic Oath." Reporters were typing furiously. Cameras flashed, and Nathan Cross's lawyers were leaning in, whispering urgently, but he waved them away, his eyes locked on Evelyn's face. "The CEO of Meridian Solutions is my ex-husband," Evelyn continued, watching Nathan's expression freeze. "I divorced him 20 years ago because I saw what kind of man he was becoming. Someone who believed profit justified any cost. Someone who would sacrifice anyone, including American soldiers, to build his empire." Now the reporters erupted, shouting questions. Evelyn ignored them, kept talking. "I had no idea Nathan was behind Meridian Solutions until last night, but it doesn't surprise me. This is exactly who he always was. And I'm testifying against him not because of our history, but because 21 soldiers are dead and someone needs to speak for them." She stepped back from the podium. The room exploded with noise, questions, camera shutters, Nathan's lawyers trying to get their client out of the room. But Nathan didn't leave. He stood, pushing past his legal team, and approached the stage. Security moved to intercept him, but Hale held up a hand. "Let him speak." Nathan stepped to a microphone set up for questions. His smile was back, though it looked strained now. "Evelyn, it's been a long time. I'm sorry you feel the need to drag our failed marriage into this manufactured crisis, but my company has done nothing illegal. We conduct legitimate research under government contract, with full oversight and approval. If individuals within the organization broke protocols, they'll be held accountable. But I won't stand here and let you destroy Meridian Solutions because you're still angry about our divorce." The room went silent. Evelyn felt the weight of every eye on her, waiting to see if she'd crack, if she'd lose control and prove Nathan's narrative that this was personal vendetta instead of justice. She walked back to the microphone, her voice steady and cold. "Show them the contracts, Nathan. The ones for the coagulation disruptor. Show them the research protocols that authorized human testing without informed consent. Show them the payments to Dr. Richard Voss and the other medical professionals you bribed to poison their own patients. Those documents are classified. They were declassified this morning by order of the Secretary of Defense. Would you like me to read them out loud, or will you?" Nathan's face went white. His lawyers were frantically motioning for him to stop talking, to leave, to invoke his Fifth Amendment rights. But ego and fury had taken over. "You have no proof. You have the testimony of disgruntled employees and—" "We have video footage from your facility in Nevada," Reeves interrupted, stepping to the podium. "Footage showing test subjects in cages being systematically poisoned. We have financial records showing payments to hospital administrators across 6 states. We have Dr. Voss's full confession, implicating you directly in ordering the murder of General Marcus Hale. And we have 2 surviving attackers from last night who are currently cooperating with federal prosecutors in exchange for reduced sentences. The room erupted again. Nathan stood frozen at the microphone, his carefully constructed defense crumbling in real time. Then federal marshals appeared from the sides of the room, moving with purpose toward where Nathan stood. "Nathan Cross," one of them said, "you're under arrest for conspiracy to commit murder, illegal weapons testing, fraud, and terrorism. You have the right to remain silent." They handcuffed him right there, in front of every camera, every reporter, every person who'd believed his lies. His lawyers were shouting about due process and jurisdiction, but it didn't matter. The evidence was overwhelming. The truth was out. As marshals led Nathan away, he looked back at Evelyn one last time. The smile was gone now, replaced by pure hatred. "You'll regret this," he said. Evelyn met his eyes. "The only thing I regret is not stopping you 20 years ago." Then he was gone, and the press conference descended into controlled chaos as reporters shouted questions and military officials attempted to maintain order. Evelyn stepped away from the podium, her role finished, and found Hale waiting in the wings. "You did well," he said simply. "I just destroyed my ex-husband's life on live television. You exposed a criminal enterprise that murdered American soldiers. There's a difference." Hale guided her toward a quiet hallway. "How are you holding up?" Evelyn thought about it. "I'm not sure. Ask me tomorrow." They walked in silence for a moment before Hale spoke again. "The Nevada raid is postponed. After last night's attack, security protocols require a full review before we can proceed. We're looking at a week, maybe 2. Those test subjects don't have 2 weeks. I know, we're sending in a preliminary medical team tomorrow to stabilize anyone in immediate danger. But the full extraction operation needs proper planning, proper resources." Hale paused. "You've done enough, Evelyn. More than enough. If you want to step back, focus on recovering from last night. I'm going on the Nevada raid," Evelyn said firmly. "Those people need someone who understands what's happening to their bodies, someone who won't give up on them even when the medical situation seems hopeless. That's me. That's what I do." Hale studied her face, then nodded. "Then you'll go. But with full tactical support and every resource we can provide. I'm not losing you to another attack." Over the next 72 hours, the full scope of Meridian Solutions crimes emerged. Federal investigators raided company offices across 12 states, seizing documents and arresting executives. The nurse who'd been spying at Blackstone Memorial gave testimony that implicated hospital administrators in the cover-up. And Dr. Voss, faced with life in prison, provided a detailed account of every patient he'd poisoned, every test he'd conducted, every dollar he'd been paid. The death toll climbed. 21 soldiers had died from the coagulation disruptor, 17 more from other experimental compounds. 38 test subjects were currently being held at the Nevada facility, most in critical condition. And an unknown number of deaths had been disguised as natural causes or accidents, their families never knowing their loved ones had been murdered. Evelyn spent those 3 days preparing for the Nevada raid, studying the medical protocols for the nerve agent compound, and visiting the survivors from the first facility. Morrison was off the ventilator now, weak but conscious, able to speak in short sentences. Michael Chen was being treated for PTSD alongside his physical recovery. The others were progressing, fighting their way back from the edge of death. On the 4th day, Evelyn received a visitor she hadn't expected. Sarah, her daughter, appeared at the military facility looking exhausted and worried and furious. "You didn't tell me Nathan was involved," Sarah said without preamble. "I had to learn from the news that my father tried to have you killed." Evelyn looked at her daughter, 28 years old, brilliant, beautiful, caring none of Nathan's cruelty. "I didn't want to drag you into this. I'm already in it. He's my father, and everyone wants to know if I knew, if I helped him, if I'm part of the conspiracy." Sarah's voice cracked. "People are calling me, Mom. Reporters, lawyers, random strangers who somehow got my number. They want statements about what kind of man Nathan Cross is." "What did you tell them?" "That I haven't spoken to him in 5 years. That when I learned what kind of business he was running, I cut all contact. That the man who donated sperm doesn't get to define who I am." Sarah sat down heavily. "But they don't care. They just want the story." Evelyn pulled her daughter into a hug. "I'm sorry. I never wanted this to touch you."
It's not your fault. It's his. Sarah pulled back, wiped her eyes. I want to help. With the trial, with the survivors, with whatever you need. I'm a lawyer. I can review documents, coordinate with prosecutors, make sure Nathan and everyone who worked with him faces consequences. You don't have to do that. Yes, I do. Because 21 soldiers are dead, and one of them could have been someone I knew, someone I cared about. This isn't just about you and Nathan. It's about making sure this never happens again. Evelyn saw herself in her daughter's determination, in her refusal to look away from hard truths. Okay, talk to Reeves. He'll get you clearance and access to the case files. Sarah left to coordinate with the legal team, and Evelyn returned to her medical preparations. But something was nagging at her, some detail that didn't quite fit. She pulled up the files on the Nevada facility, studying the layout, the security protocols, the number of test subjects. 38 patients, according to intelligence reports. But the facility had been built to house 50. Where were the other 12? She brought her concerns to Reeves, who pulled up satellite imagery of the Nevada compound. The main building was clearly visible, along with several support structures, but there was one building, smaller, set apart from the others, that didn't appear on any of the official blueprints. What is that? Evelyn asked, pointing. Reeves enhanced the image. The building looked new. Its concrete still light-colored, its security fence higher and more robust than the others. Unknown. It's not in any of the documents we seized from Meridian Solutions. Because they didn't want anyone to know it existed. Evelyn felt cold certainty settling over her. That's where the other 12 subjects are. That's where they're conducting the research they couldn't risk documenting. Intelligence confirmed her suspicions within hours. The mystery building had been constructed 4 months ago using off-the-books contractors. Power consumption was 3 times higher than any other structure on the facility, and thermal imaging showed multiple heat signatures inside. People, at least a dozen of them. We're revising the raid plan, Reeves said grimly. That building becomes a primary target. We breach it first, secure whatever subjects are inside, and extract before Meridian security can respond. What kind of security are we expecting? More than last time. Intelligence suggests they've hired private military contractors, former special forces, heavily armed, willing to kill to protect their employer's secrets. Reeves pulled up photos of the security personnel. These aren't rent-a-cops, they're professionals. The Nevada raid launched at 0300 on a moonless night. Evelyn rode in a helicopter with Torres and a medical team that had been expanded to include 2 trauma surgeons and 4 critical care specialists. Below them, the desert stretched dark and empty, hiding the facility where 12 more victims waited. The helicopters came in fast and low, avoiding radar and using the terrain to mask their approach. When they popped up over the final ridge, the facility appeared like a small city of lights, buildings, fences, guard towers, all surrounded by empty desert. 2 minutes, the pilot announced. Evelyn checked her medical kit one final time, her hands steady despite the fear thrumming through her veins. This was bigger than the first raid, more dangerous, with more at stake. But that didn't matter. 12 people needed her, and she wasn't going to let them down. The helicopters split into 2 groups, half headed for the main buildings where the 38 known subjects were being held. The other half, including Evelyn's bird, descended on the mystery structure, the one Meridian Solutions didn't want anyone to find. They landed 50 meters from the building. Operators poured out, weapons raised, moving in perfect coordination toward the entrance. Evelyn followed with the medical team, her heart pounding as explosives breached the door and operators flooded inside. The smell hit her first. Antiseptic and rot, sterile equipment and dying flesh. Then she saw the room, and her mind struggled to process what she was seeing. 12 beds, just like before. But these subjects weren't simply sick. They were being vivisected, their bodies kept alive while researchers systematically removed and studied their organs. Medical equipment surrounded each bed, monitoring hearts and lungs and kidneys that were in various stages of harvest. And standing among it all, still in his surgical gown, was a doctor Evelyn recognized from her time at Blackstone Memorial. Dr. Peter Klein, thoracic surgeon, award-winning researcher, and apparently someone willing to dissect living human beings in the name of science. He looked up as operators secured the room, his eyes meeting Evelyn's across the space filled with horror. "Hello, Evelyn," he said calmly, as if they'd run into each other at a coffee shop instead of a torture chamber. I wondered if they'd send you. Evelyn's training took over before her horror could paralyze her. She moved past Klein without acknowledging him, her eyes scanning the 12 beds, assessing which patients could be saved and which were already lost. The operators were zip-tying Klein and 2 research assistants, but Evelyn didn't care about them. She cared about the bodies still breathing on those tables. I need these monitors disconnected carefully, she said, her voice cutting through the chaos. Don't just yank the lines. Some of these patients are being kept alive by external circulation. Torres appeared at her elbow. External circulation? Their hearts and lungs have been compromised. The machines are doing the work. Evelyn moved to the nearest bed, to a young woman whose chest had been opened and partially sutured back together. The surgical technique was precise, clinical, the work of someone who knew exactly what they were doing. She's still alive, barely. We need to stabilize her before transport. One of the trauma surgeons joined her, took one look at the woman's exposed organs, and went pale. This is monstrous. How long has she been like this? According to the chart, Evelyn grabbed the clipboard hanging on the bed. 4 days. They're studying tissue regeneration under active stress conditions. The surgeon's hands were shaking as he helped Evelyn assess the damage. We need to close her chest, get her on portable life support, and pray she survives the helicopter ride. They worked in tandem, moving from patient to patient. 3 were already dead, their bodies kept on machines for organ harvesting that would never happen now. 4 more were in states so critical that moving them would likely be fatal. That left 5 who might survive if everything went perfectly. Evelyn directed the medical team with the kind of authority that came from having already walked through hell twice and knowing the path. Surgical trays appeared. Portable ventilators were positioned. IV medications were calculated and administered with precision that left no room for error. Through it all, Klein watched from where he sat zip-tied against the wall. His expression was calm, almost curious, as if he were observing an interesting experiment rather than witnessing the rescue of his victims. You won't save them all, he said conversationally. The physiological damage is too extensive. Subject 7 has maybe an hour before her kidneys shut down completely. Subject 3's brain is already showing signs of hypoxic injury. Evelyn finished intubating Subject 7 and turned to face him. Stop calling them subjects. They're people. They have names. Names are irrelevant to the research. What matters is the data. The data? Evelyn's voice went cold. You dissected living human beings. You kept them conscious while you removed their organs. You documented their suffering like it was a science project. Klein actually smiled. It was a science project, one that would have revolutionized battlefield medicine if you and your military friends hadn't interfered. We were learning how to keep soldiers alive in conditions that would normally be fatal. How to regenerate damaged tissue, how to maintain organ function even after catastrophic injury. By torturing people? By pushing the boundaries of medical knowledge, something you'd understand if you weren't so limited by ethical hand-wringing. Klein's eyes glittered with something that might have been madness or just absolute conviction in his own righteousness. You saved General Hale by recognizing a coagulation cascade disruption. Do you know how I learned to identify those patterns? By watching them develop in real time, in controlled conditions, in subjects whose bodies taught me things no textbook ever could. Torres moved forward, her hand on her sidearm. Sir, I really need you to stop talking before I forget we need you alive for trial. But Evelyn held up a hand. No, let him talk. Let everyone hear exactly what kind of monster Meridian Solutions employed. One of the operators was recording everything, standard protocol for evidence collection. The camera captured Klein's calm expression, his clinical tone, his complete lack of remorse. I'm not a monster, Klein said. I'm a scientist who understands that progress requires sacrifice. Those 12 subjects, yes, I'll use your preferred terminology. Those 12 people contributed more to medical advancement than they ever would have in their ordinary lives. Their pain had purpose. Their pain had profit, Evelyn corrected. Meridian Solutions was going to sell your research to the highest bidder. Foreign governments, terrorist organizations, anyone willing to pay for weapons disguised as medical breakthroughs. Something flickered in Klein's expression. That wasn't supposed to happen.
Nathan Cross promised the research would only be used by American military. Nathan Cross lied. He's been selling classified research to foreign buyers for the last 3 years. Did you really think a man who ordered the murder of a general would honor his promises to you? Klein's certainty faltered. For the first time, doubt crept into his face. He said, he promised the work was for national defense. He said whatever kept you compliant and productive. Evelyn turned back to her patients. You're not a visionary. You're a dupe who let himself believe torture was justified because someone told you it served a greater good. The medical team worked for another 20 minutes, stabilizing the 5 survivors as much as possible. Subject 7, whose chart listed her real name as Lieutenant Sarah Martinez, required emergency surgical intervention that Evelyn performed right there on the table, her hands steady as she repaired damage that should have killed the woman days ago. When they finally wheeled the survivors toward the helicopters, Evelyn took one last look at the room. The empty beds, the blood-stained equipment, the monitors still beeping even though no one was connected to them anymore. This place would be dismantled, studied, used as evidence. But it would also haunt her, she knew. Some images you couldn't unsee. The extraction from the main facility went smoother than expected. The 38 subjects there were sick but hadn't been subjected to the same horrific procedures. Most were conscious, aware, able to understand they were being rescued. The private military contractors Meridian had hired to guard the facility surrendered without firing a shot once they saw the overwhelming force arrayed against them. By dawn, all surviving subjects were in military helicopters heading toward trauma centers across 3 states. Evelyn rode with Lieutenant Martinez, monitoring her vitals and adjusting medications during the flight. The woman regained consciousness briefly, her eyes focusing on Evelyn's face. "Am I dead?" Martinez whispered. "No. You're alive. You're safe." Evelyn squeezed her hand. "My name is Evelyn Cross. I'm a nurse. You're in a military helicopter and we're taking you to a hospital where you'll receive proper care. The doctor, he said no one would come, that we'd been forgotten." "You weren't forgotten, and that doctor is going to prison for the rest of his life." Evelyn kept her voice gentle. "Right now, I need you to focus on breathing and staying calm. Can you do that for me?" Martinez nodded weakly and slipped back into unconscious, but her vitals remained stable. She was a fighter. She'd survived 4 days of systematic torture. She'd survived this too. The weeks that followed blurred together in a cascade of trials, testimonies, and media coverage that turned Evelyn into an unwilling public figure. The trial of Nathan Cross became the most watched legal proceeding since Watergate. Federal prosecutors presented overwhelming evidence. Video footage from the facilities, financial records showing bribes and payoffs, testimony from dozens of witnesses including Voss and Klein, and the living survivors whose bodies bore the scars of Meridian Solutions' crimes. Nathan's defense team tried every strategy. They claimed he'd been unaware of the illegal research. They argued that rogue employees had acted without authorization. They attempted to paint Evelyn as a vindictive ex-wife manufacturing evidence to destroy him. None of it worked. The jury deliberated for 4 hours. They found Nathan Cross guilty on all 43 counts, including conspiracy to commit murder, illegal human experimentation, fraud, treason, and terrorism. The judge sentenced him to life in prison without possibility of parole. Evelyn watched from the gallery as federal marshals led Nathan away in handcuffs. He didn't look at her, didn't acknowledge her presence. He'd already begun the psychological process of denial, of rewriting history so he was the victim of a vast conspiracy rather than the architect of mass murder. She didn't care what stories he told himself. Justice had been served. Dr. Richard Voss received a similar sentence, as did Dr. Peter Klein and 17 other medical professionals who'd participated in the research. The hospital administrator at Blackstone Memorial, who'd helped cover up the deaths, was sentenced to 20 years. The nurse who'd spied for Meridian Solutions received 10 years plus forfeiture of her medical license. More than 60 people connected to Meridian Solutions were prosecuted. The company itself was dissolved, its assets seized and distributed to the families of victims. Several foreign government officials who'd purchased the illegal research were identified, triggering an international scandal that resulted in sanctions and diplomatic consequences. But the numbers that mattered most to Evelyn were these: 43 survivors from the 2 facilities, 43 people who'd been used as experimental subjects and lived to tell about it. Not all of them recovered fully. Some carried permanent damage, organ failure, neurological deficits, psychological trauma that would take years of therapy to process. But they were alive. They had futures. They had the chance to rebuild lives that had been stolen from them. Lieutenant Sarah Martinez recovered enough to give testimony at Nathan Cross's trial. She stood in front of the jury, showed them the scars on her chest where Klein had opened her up, and described in clinical detail what it felt like to be conscious while someone removed your organs for study. Several jurors cried. The defense attorney had no questions. Staff Sergeant David Morrison was medically retired from the military, but took a position training new combat medics, using his experience to teach them how to recognize the signs of chemical warfare and medical experimentation. He told Evelyn he wanted to make sure no one else went through what he had. Michael Chen enrolled in college, studying pre-law with the intention of becoming a prosecutor specializing in medical ethics cases. He was 19, brilliant, and determined to turn his trauma into purpose. 3 months after Nathan's sentencing, Evelyn stood on a stage at the Pentagon receiving the Presidential Citizen's Medal. The Secretary of Defense read a citation detailing her actions, saving General Hale, diagnosing the coagulation disruptor, participating in 2 facility raids, providing medical care under fire, and testifying against a criminal conspiracy that reached the highest levels of defense contracting. The president himself placed the medal around her neck and shook her hand. Cameras flashed. Reporters shouted questions. And Evelyn felt nothing but a quiet satisfaction that the work was done. After the ceremony, Hale found her in a side room where she'd retreated to escape the crowd. He looked fully recovered now, back in uniform, his eyes sharp and clear. "How does it feel to be a national hero?" he asked. "Exhausting." Evelyn touched the medal hanging around her neck. "I'm a nurse. I just want to take care of patients." "Then that's exactly what you'll do." Hale handed her a folder. "Official offer from the Military Medical Corps, Chief of Trauma Services for Special Operations. You'll oversee medical care for classified missions, train combat medics, and build protocols for handling unconventional injuries and exposures." Evelyn opened the folder, scanned the details. The salary was more than she'd made at Blackstone Memorial. The position came with full authority over medical decisions. No administrators to second-guess her, no bureaucracy to navigate, just medicine practiced at the highest level with the best resources available. "There's one condition," Hale added. "You have to take Torres and 3 other nurses of your choosing. Build your own team, people you trust, who share your values, who won't compromise patient care for politics." "When do I start?" "Whenever you're ready. The position is yours as long as you want it." Evelyn looked at the medal, at the folder, at the future being offered to her. 6 months ago, she'd been scrubbing dog kennels, her career destroyed, her name ruined. Now she had the chance to revolutionize military medicine, to build something that would save countless lives. She thought about Marissa, still working at Blackstone Memorial, but increasingly frustrated with the administration. She thought about the young nurses she'd mentored over the years, the ones with talent and dedication who deserved better opportunities. She thought about building a team where competence mattered more than politics, where saving lives took precedence over protecting reputations. "I'll need 3 weeks to recruit my team and get my affairs in order," Evelyn said. "After that, I'm all yours." Hale smiled. "Welcome aboard, Chief." The news that Evelyn was joining the Military Medical Corps made headlines, though smaller ones than the trial coverage. Several articles noted the irony of a woman fired for breaking protocol being put in charge of medical operations where breaking protocol might be the only way to save lives. Evelyn ignored the commentary. She had work to do. She recruited Marissa first, offering her the position of deputy chief, and watching her friend's face light up with the kind of joy that came from being valued after years of being overlooked. Then she brought in Torres, who'd proven herself capable under impossible pressure during both raids. 2 more nurses rounded out the core team, specialists in trauma care and toxicology, both with military experience, both recommended by people Evelyn trusted. Blackstone Memorial held a press conference announcing that Evelyn Cross's firing had been a regrettable misunderstanding, and they hoped she'd consider returning to her position. The hospital board offered her a formal apology, a raise, and a promise of full autonomy over her medical decisions. Evelyn declined via a single-sentence email. I've accepted a position where my medical judgment is valued rather than questioned. The hospital's PR department tried to spin it as an amicable parting. Evelyn didn't bother correcting them. Blackstone Memorial was part of her past now, and she was focused on the future. She visited each of the survivors before reporting for duty, checking on their progress and offering whatever support she could provide. Morrison was thriving in his new role, finding purpose in teaching others. Martinez was still in physical therapy, but making steady progress. Michael Chen showed her his acceptance letter to Georgetown Law School, his eyes bright with determination. "You saved my life," he said simply. "I'm going to spend mine making sure what happened to us never happens to anyone else." "You're going to make an excellent lawyer," Evelyn told him. "But remember, the law is a tool, not a solution. Real change happens when people refuse to look away from hard truths." On her last day as a civilian, Evelyn drove to the cemetery where the 21 soldiers killed by Meridian Solutions were buried. Their families had arranged for a memorial garden, a quiet space with benches and flowers and plaques bearing each soldier's name. Evelyn walked among the graves, reading the names, the dates, the descriptions of lives cut short. Private First Class Danny Reeves, the soldier whose life she'd saved 6 months ago, was waiting for her there. He'd made a full recovery, returned to active duty, and requested assignment to the Medical Corps Support Unit. "Major General Reeves told me I'd find you here," Danny said. "I wanted to pay my respects." Evelyn gestured to the memorial plaques. "These people died because someone valued profit over lives. I wanted them to know that their deaths weren't in vain, that we caught the people responsible." "They know." Danny moved to stand beside one of the plaques. "My cousin, Jake, he was one of the 14 from the first facility. The official report said he died from a heart attack during a routine physical, but I always knew something was wrong. The timeline didn't make sense. The symptoms weren't right." He touched the plaque gently. "You proved I wasn't crazy. You proved they were murdered." They stood in silence for a while, two people connected by the same thread of loss and justice. Finally, Danny spoke again. "I heard you're building a medical team for special operations. I want to be part of it. I want to be a combat medic who actually knows how to recognize when someone's being poisoned instead of just sick." Evelyn looked at him, young, earnest, carrying the weight of his cousin's death but not letting it break him. "Talk to Major General Reeves. Tell him I recommended you for the training program. If you make it through, you'll have a place on my team." "I'll make it through." Danny's voice carried absolute conviction. "I owe that to Jake, to all of them." Evelyn reported for duty on a clear morning in late October. The military medical facility where she'd be working was state-of-the-art, equipped with technology she'd only dreamed about during her civilian career. Her team had their own wing, their own equipment, their own authority to make medical decisions without administrative interference. Reeves gave her a tour, introducing her to the other department heads and making it clear that her position carried significant authority. She wasn't just another nurse anymore. She was Chief Cross, officer in charge of trauma services, someone whose expertise was valued and respected. Her office had a window overlooking the training grounds where combat medics practiced emergency procedures. On her desk sat a framed photograph. The survivors from both facility raids, all together for the first time, standing in front of the memorial garden. 43 people who'd survived because Evelyn had refused to look away, refused to accept easy answers, refused to let authority intimidate her into silence. The photograph had been Torres's idea, a reminder of why they did this work. Evelyn positioned it where she'd see it every morning, every time she made a difficult decision, every time she needed to remember that protocol served patients, not the other way around. 3 weeks into her new position, Evelyn received an unexpected visitor. Sarah, her daughter, appeared at the facility carrying legal documents and looking simultaneously nervous and determined. "I've been appointed as special counsel to the DOJ task force investigating defense contractor fraud," Sarah said without preamble. "They want someone who understands both the legal and personal implications of what Meridian Solutions did, someone who can make sure we find every company trying to follow in Nathan's footsteps." Evelyn pulled her daughter into a hug. "That's incredible. You're going to do amazing work." "I'm terrified," Sarah admitted. "This is huge. What if I'm not ready?" "You're ready," You've been ready since you were 10 years old and argued your way out of being grounded by citing precedent from prior disciplinary discussions. Evelyn held Sarah at arm's length, looked at her seriously. Your father tried to turn his intelligence toward destroying people. You're using yours to protect them. That's the difference that matters. Sarah stayed for dinner at Evelyn's new apartment. Small but comfortable, close enough to the facility that she could respond to emergencies quickly. They talked about the trials, about the survivors, about the long process of rebuilding lives that had been shattered. And they talked about Nathan, about the man he'd been and the monster he'd become, about the relief of knowing he could never hurt anyone again. "Do you ever regret marrying him?" Sarah asked. Evelyn considered the question carefully. "I regret the pain he caused. I regret not seeing his true nature sooner, but I don't regret the marriage itself because it gave me you, and you're the best thing I've ever done." 6 months after taking her position with the Military Medical Corps, Evelyn stood in front of a congressional committee investigating defense contractor oversight and military procurement fraud. The room was packed with senators, staff members, journalists, and advocates. Cameras recorded every word. Senator Catherine Morrison, mother of Staff Sergeant David Morrison, led the questioning. "Chief Cross, based on your experience with Meridian Solutions and subsequent investigations, what systemic changes would you recommend to prevent this kind of abuse in the future?" Evelyn had prepared for this moment. She'd spent weeks working with Sarah and other legal experts, crafting recommendations that would actually make a difference rather than just sound good in press releases. "First," she said, "mandatory independent medical review for all research involving military personnel. Not military doctors who might feel pressure to approve questionable studies, but civilian experts with no financial ties to defense contractors." She continued through her list. Stronger whistleblower protections for medical professionals who reported unethical research, criminal liability for executives who approved illegal testing, regular audits of facilities conducting classified medical research, and victim compensation funds that didn't require non-disclosure agreements. The committee members took notes, asked follow-up questions, and actually seemed to listen. Senator Morrison was particularly engaged, her questions sharp, and informed by her personal stake in ensuring reform. "How many other Meridian Solutions are out there?" the senator asked. "Unknown," Evelyn admitted. "But based on the financial analysis conducted by the DOJ task force, we believe there are at least 6 other defense contractors conducting similar research. Some might be legitimate. Others," she paused, "others are probably doing exactly what Meridian did, just more carefully. And what do you say to the families of soldiers who might currently be unknowing test subjects?" Evelyn looked directly at the cameras, at the millions of people watching. "Report anything suspicious. If your loved one's symptoms don't make medical sense, if their death was attributed to natural causes, but the timeline seems wrong, if you have any reason to believe they were part of unauthorized research, contact the DOJ task force. We're investigating every case, no matter how old." The hearing lasted 6 hours. By the end, 3 senators had committed to sponsoring comprehensive reform legislation. The media coverage focused on Evelyn's testimony, calling her the nurse who brought down a billion-dollar conspiracy and a hero who refused to stay silent. Evelyn ignored the attention. She had patients to care for, a team to build, and work to do. 1 year after the Nevada raid, the Military Medical Corps hosted a ceremony honoring everyone who'd participated in the rescue operations. Medals were awarded, commendations were read, and the surviving test subjects were invited to attend as guests of honor. 43 people showed up. Some came in wheelchairs, still recovering from injuries that would never fully heal. Others looked healthy and whole, their scars hidden beneath civilian clothes. They mingled with the operators who'd breached the facilities, with the pilots who'd flown the helicopters, with the medical personnel who'd kept them alive during those desperate evacuations. Evelyn moved through the crowd, checking on people she'd come to know well over the past year. Martinez was there with her young daughter, explaining to the child why Mommy had so many scars. Morrison had brought his new class of combat medic trainees, using the ceremony as a teaching moment about why their work mattered. Michael Chen arrived straight from classes at Georgetown, still wearing his law school hoodie, looking younger than his 20 years, but carrying himself with new confidence. When the ceremony began, General Hale took the podium and delivered a speech about courage, resilience, and the cost of justice. He talked about the operators who'd risked their lives, the prosecutors who'd worked tirelessly to build their cases, and the survivors who'd found the strength to testify against their torturers. Then he called Evelyn to the stage. "Chief Cross," Hale said, "you've already received the Presidential Citizens Medal, but there's one more honor that's long overdue." An aide appeared carrying a framed document. Hale took it and turned it toward the audience so the cameras could capture the image. A formal apology from the Secretary of Defense, acknowledging that the military medical system had failed to protect soldiers from illegal experimentation, had failed to recognize the warning signs, and had failed to act until Evelyn forced the truth into the light. "This apology is also an acknowledgement," Hale continued. "An acknowledgement that sometimes the people who break the rules are the ones who save lives. That sometimes questioning authority is the most patriotic thing you can do. And that your willingness to risk everything, your career, your safety, your life, saved 43 people who would otherwise be dead." The room erupted in applause. The survivors stood, clapping and cheering. The operators joined in, their usually stoic faces showing genuine emotion. And Evelyn stood there, holding a document that represented vindication, not just for herself, but for every medical professional who'd ever been punished for doing the right thing. After the ceremony, Evelyn found a quiet corner where she could watch the survivors talking with each other, forming bonds over shared trauma and shared survival. Torres appeared beside her with 2 glasses of champagne. "To breaking rules that deserve to be broken," Torres said, raising her glass. Evelyn clinked her glass against Torres's. "To saving lives no matter what it costs." They drank, and Evelyn felt something settle in her chest, a sense of completion, of having walked through fire and emerged not just alive, but stronger. She thought about the woman who'd been escorted out of Blackstone Memorial in the rain, who'd believed her career was over, who'd spent 6 months scrubbing dog kennels while the world forgot she existed. That woman was gone. In her place stood someone who'd changed military medicine, who'd brought down a criminal empire, who'd proven that one person refusing to stay silent could topple systems designed to silence them. Her phone buzzed with a message from Reeves. "Got a situation that needs your expertise. How soon can you deploy?" Evelyn smiled. This was her life now. Urgent calls, impossible situations, medical mysteries that required someone who thought creatively and acted decisively. This was what she'd been trained for, what she was built for, what she'd been doing all along before bureaucrats tried to tell her she was wrong. She texted back, "Give me 30 minutes. Torres saw her expression change. "We've got a case?" "Looks like it." Evelyn finished her champagne and set down the glass. "Duty calls." "Always does." Torres was already moving toward the exit, pulling out her phone to alert the rest of the team. "What are we dealing with?" "Unknown, but Reeves doesn't call unless it's serious." They left the ceremony, heading toward whatever emergency needed them, leaving behind the applause and the speeches and the recognition. Because at the end of the day, medals and honors were nice, but they weren't why Evelyn did this work. She did it for the soldiers who trusted the system to protect them. She did it for the families who deserve truth instead of lies. She did it for every patient who needed someone willing to fight for them when no one else would. The helicopter was already warming up when they arrived at the flight line. Evelyn climbed aboard, secured her medical kit, and watched as her team filed in. Torres, Marissa, the 2 specialists she'd recruited, all of them ready to face whatever challenge waited. All of them trusting her judgment, her experience, her willingness to break rules when rules got in the way of saving lives. As the helicopter lifted into the night sky, Evelyn looked back at the ceremony still happening below, at the building lit up against the darkness, at the life she'd built from the ashes of the one that had been taken from her. She thought about Nathan in his prison cell, about Voss and Klein, and all the others who'd believed they could get away with murder. She thought about the 43 survivors who'd proven that evil didn't always win, that justice was possible, that one nurse with a stethoscope and absolute conviction could change the world. The helicopter banked hard, heading toward whatever emergency awaited them. Evelyn felt the familiar surge of adrenaline, the sharp focus that came when lives hung in the balance. This was who she was now, not the nurse they'd fired, not the victim they'd tried to silence, not the ex-wife seeking revenge. She was Chief Evelyn Cross, the woman who'd brought down a conspiracy and rebuilt military medicine in its wake. The woman who'd proven that being underestimated was just another advantage, that being dismissed gave you freedom to work without oversight, that being written off meant no one saw you coming until it was too late to stop you. They'd called her reckless. They'd called her insubordinate. They'd called her a liability and a problem and someone who didn't know her place. They'd been wrong about all of it. And as the helicopter carried her toward the next battle, the next patient who needed someone willing to fight for them, Evelyn smiled, because she finally understood something that had taken her 54 years to learn. Her place wasn't where anyone else said it should be. Her place was wherever people needed her, and she'd defend that place with every skill she possessed, every lesson she'd learned, every scar she'd earned. The night swallowed the helicopter, and below, the world continued turning. Somewhere, someone was being underestimated. Somewhere, someone was being told they didn't belong, that they should know their place, that they weren't good enough. Evelyn hoped they had the courage to prove everyone wrong, just like she had. The end.